So, my name's Connor. As I said, I'll be representing the pro life position today. And I think that pregnancy can lead to a host of emotions and issues. The disagreement today is primarily on the solutions to these issues. Perhaps you disagree and find yourself on the fence and say, I'm personally pro life and politically pro choice. I wish to ask you a series of questions. Why are you personally pro life? What makes you feel uneasy about abortion? But also the most basic question of, well, where do babies come from? And when does human life begin? My argument goes like this. Premise one, it is prima facie means at the face of it, at first glance, wrong to directly kill innocent human beings, and it should be illegal. Premise two, abortion directly kills an innocent human being. And my conclusion, abortion is prima facie wrong and should be illegal. My main argument today is from the standpoint of equal rights for all human beings. I'm here to argue the fundamental difference between me and a fetus is not of kind, but rather of age. Just like how I was once a toddler or a baby, I was also once a fetus. And we do know that, at least scientifically speaking, that a new human organism's life begins at conception, and I do have a source if you would like that. Maybe you think that this is ridiculous to suggest a human life begins at conception. However, in many countries, there are actually legal protections of embryos after the 14-day mark already for genetic research, despite the fact that there is criticisms of this rule. There has also been documented cases of embryo rescue in the United States with IVF clinics. Before we even approach the pro-choice arguments, let us ask ourselves a really basic question. Do we really, it might seem ridiculous, but do we really think it's okay for us to kill a 1 or 2-year-old because they need their parents to survive? Even if it may cause us problems in that case, I think many pro-choicers would rationally agree that it'd be wrong to kill a 2-year-old so a woman can go to college or her general well-being improves. But now I ask you, why would it be okay to abort the same child when they're 8 or 10 weeks old in the womb? The two main arguments rejecting the pro-life position can be categorized into two main groups, I think. These are the bodily autonomy arguments and the consciousness arguments. The first, the bodily autonomy arguments, argues that a woman has a right to her body, therefore it is her choice to pursue an abortion. This is popularized by Judith Jarvis Thompson and David Boonin. Both these arguments compare pregnancy as a woman unplugging herself from the child as if it were life support, and the woman is simply refusing to donate an organ, her uterus. However, I have noticed that nowhere in the pro-life position, or pro-life movement, is it actually requiring women to donate their uterus to sick or disabled children and making them become pregnant. I think this argument fails simply because it's disanalogous. The cause of death is not an underlying condition in an abortion, but it's actually the hands of the person who administers the medication. This would entail that the case of abortion falls under my second premise of being a direct killing. As well, I'm pretty sure, hopefully I don't miscategorize you today, my opponent does not believe in abortions up until birth. At some point, this would mean, necessarily, a characteristic, viability, or consciousness would have to outweigh a woman's bodily autonomy at some point in pregnancy. Therefore, I do not see this as an appropriate justification. And for the sake of it, I will be defining an induced abortion as a procedure to terminate intrauterine or unborn life. We can talk about that later if you'd like. So, what happens with an abortion? As I mentioned, the cause of death of the child will be a medication or surgery inducing a series of actions that lead to possible starvation, dehydration, or even desanguination of the little human being in the womb. Later terms of abortions literally involve digoxin to induce cardiac arrest in the child, and then they will literally remove the body from the womb. And then now we talk about consciousness arguments, and this is what I believe the primary position of my opponent will be defending today. This is around 20 weeks of pregnancy, where a human being reaches a stage of development or brain activity that we recognize as a person. Typically, this is based on the idea that since life ends with brain death, then life begins with some form of brain activity or brain development. I will grant for the time being, from an epistemic standpoint, that sometime around 20 to 28 weeks, a person becomes conscious of their surroundings. But I think this suffers from a major flaw in terms of value. And the reason why is that animals that we do not see as persons, particularly those such as squirrels, deer, rats, or pigs, are not seen as equals or persons like you or me. However, they have some level of consciousness. These animals even have been shown and demonstrated to operate mazes and solve puzzles. Pigs can even recognize themselves in a mirror, while 1-year-old humans cannot. So what is the difference between a human being's level of consciousness at 22 weeks in utero and an adult pig that can solve a puzzle? I don't know about you, but many Americans eat pigs, and I don't think that we're going to charge people who eat bacon cheeseburgers for murder. So, what even is this new thing that we're creating in the womb? So, we can also talk about the comatose arguments, or if someone's unconscious, or painkillers. But some argue consciousness does not even develop until 26 weeks. Remember, a full pregnancy is around 40 weeks. So 26 weeks, New York University says this is because the thalamus does not fully form. However, the youngest child born in a NICU unit was born at 21 weeks. So that means consciousness, 26 weeks, in some estimates, earliest born human being, 21 weeks. And I think most people would intuitively say that we would not be okay to kill the child in the NICU unit just because they are not as conscious. So, what is a person? A person is a human being. And if you want to pursue the religious route, the reason that human beings are valuable is because they're made in the image of God. If you want to pursue a more secular route, it would be that they are part of a rational kind as we respond to reasons. We are debating. I'm not too sure if pigs debate over what is right and wrong like we do. Um, so this criteria would also extend to if we pursue the secular route, as I mentioned earlier, like if Superman or Luke Skywalker came down to Earth, that they would meet this rational kind of being, or they would satisfy this criteria. But before we talk about killing aliens, I think that we should talk about the human beings in the womb. Thank you. That's my opening statement.
Sweet. I definitely have some clarifying questions, but I'll do my opening statement first, then we can get down to the nitty gritty.
All right, awesome.
But I appreciate you giving your statement, Connor. That was 6 minutes and 30 seconds I got on my side, so I'll get going on mine.
Okay.
So my argument is, I guess, more so focused on pro-choice versus, I think, more of a religious view of pro-life. But it's certainly open to talking about every route. So why I am pro-choice. Pro-choice is not pro-abortion, to be clear. It is pro-autonomy, pro-healthcare, and pro-compassion. The pro-choice position supports the legal right of every individual to make personal medical decisions, including the choice to continue or end a pregnancy. Under pro-choice laws, those who are personally pro-life can still choose not to have an abortion. What pro-choice protects is the freedom for everyone to make that decision for themselves, not to have it made for them by the government. Pro-choice policies lead to better reproductive health care for women, more clinics, fewer legal restrictions on medical providers, and more comprehensive care. Each pregnancy is unique, making it crucial that all medical options remain available and are discussed between patient and provider, not dictated by blanket laws. Beyond abortion access, pro-choice framework typically supports better sexual education and expanded access to contraception. This leads to more informed choices, safer sex, and fewer unintended pregnancies, and, surprise, fewer abortions overall. Pro-choice policies also support families after birth. Organizations such as Planned Parenthood provide parenting resources, healthcare, and support for adoption, all of which reduce the need for abortion. When people are supported with resources, options, and education, outcomes improve for everyone involved, especially the children. We must also acknowledge that forcing someone to carry a pregnancy can cause deep suffering. A rape victim faces trauma that should not be compounded by the loss of bodily autonomy. A cancer patient may risk her life to continue a pregnancy. A child developing with no chance at survival will suffer. A parent struggling in poverty may be pushed into a deeper crisis. These are not abstract hypotheticals. These are real situations, and I think we need to act with compassion and not control on these things. A non-viable fetus, however, a cluster of cells, if you will, does not suffer, but real people do. Supporting the right to choose doesn't mean supporting abortion without limits. Abortion is a serious decision, and it deserves thoughtful consideration, appropriate safeguards, and support systems, not judgment or criminalization. So once again, just to elaborate on that, I'm not advocating for absolute, just elective, at any point, abortion. There should be regulations, restrictions, barriers, whatever you want to call them, to these things. Specifically, a big point in the gestational period is, as Connor mentioned, 20 weeks. That's when the baby is effectively able to survive outside of the womb. Yes, it would need to incubate for some time, but that's when it has the ability to be its own person. Why I am anti pro life. The pro life position, when turned into law, is not just anti choice. I think it's anti freedom, it's anti science, and ultimately anti American. It imposes a single moral and religious viewpoint onto everyone, violating the principle of religious freedom in which this country was founded. Many religions and belief systems support the right to choose, yet pro life laws disregard this diversity and enforce one narrow perspective through legislation. If you are personally pro life, that is your right. But when your beliefs dictate what's right to everyone, it becomes harmful and takes away freedom. Pro life policies also place heavy burdens on healthcare workers, medical students, and researchers, many of whom are forced to work through legal and ethical constraints. The label pro life, not by everyone, but is sometimes used, in my mind, for moral posturing or moral grandstanding rather than thoughtful policymaking. I think it's really easy to chant "Don't murder babies," but I also believe that is quite the oversimplification and ignores medical, ethical, and emotional complexity of real pregnancies. And not to insult anyone who sees it that way, I think people come across or stand for these positions for many, many reasons, and I don't want to feel like people are being targeted for their position. But I also don't want to sugarcoat things. Pro-life rhetoric often shuts down that complexity with moral absolutism and more closely resembles pro-birth and pro-control. Real pro-life policies would support healthcare, childcare, paid leave, education, and maternal health, not just forced birth. Until that happens, so-called pro-life laws remain harmful, regressive, and incompatible with the freedoms this country claims to uphold. And I'm going to take this last minute just to give some examples of some women who were negatively affected by pro-life laws. Laws in states like Texas and Georgia are very, very restrictive and do a complete abortion ban after 6 weeks, except with the exception for saving the life of the mother. And doctors are forced to walk the blurry line of deciding when is the mother dying. So effectively, these doctors have to wait until they're dying. In one case, Amanda Zurowski had to wait until going into septic shock to receive care, resulting in losing half of her ovaries. So her baby was inviable, her fetus was inviable, and they couldn't abort because she wasn't dying. Hope Ngumizi died because she did not receive proper care in time. She bled out in the emergency room, I believe. Amber Thurman died because Amber Thurman died because she did not receive care in time. She's the one who bled out, I believe, in the emergency room. And then Hope in Gumezi died because she didn't receive the correct care. She received pills instead of a D and C, which is a dilation and curettage. So that's my opening statement.
Ooh, I'm excited.
If you want, yeah, I'm excited too.
Okay.
One question I had on your position, I think it was one of the first things that you said. You said you were personally pro-life, but politically pro-choice?
No, I was saying, sorry, hopefully I didn't, what's it called? I was saying that many people may identify as personally pro-life, but politically pro-choice, which was kind of like what you were getting at with your position. Like, not everyone who supports the government not making a law, they might not get abortions. Like, most women in the United States don't get abortions. But,
right.
Yeah, that just a clarification.
Yeah, absolutely. One thing you said is that abortion should be illegal, and I was wondering, is that completely? Do you have any exceptions in any case whatsoever?
Ultimately, if we're going off of my definition of induction, or the termination of intrauterine fetal life, there is the medical side of things that you brought up, which I did research some of those cases, so we can go into that. But For
Yep.
example, in Catholic hospitals, they have policy because Catholics don't provide abortions. So it's not an abortion, but there is medical procurements for women with different problems. So with me is that I believe that we can progressively come to where we get rid of all abortion. However, is that we need to take into account cultural norms, but also what's it called? Focus on bigger problems and then narrow it into a generalized ban. Because, for example, as you mentioned, even with um, rape circumstances or rape exceptions and so on, is that I think that we should focus more on, if we're going to get there, we should focus more on the vast majority of the cases before we get into the fringe cases, if that makes sense.
Okay. Yeah, and like I guess the reason I bring up those cases is just because it's a popular and common uh, topic within the abortion debate to focus on those specific cases, because in reality, those are very few cases that happen, and I think I don't think it makes sense that like abortion is banned, um, and uh, those extreme cases make up such a small percentage of abortions, and I think they're for a good reason. But I find that the mainstream media likes to talk about those often, so that's why I brought it up. But
Yeah,
also, I think having those kind of fringe conversations is important because it kind of tests the limits of people's
their logic.
positions.
Yeah, yeah, I agree
Yeah.
with you. As I said, my position is incrementally to basically that we get rid of abortion. However, I recognize that there is, like, the common intuition, relatively speaking, is that we should focus on the things people more agree with before we argue for those types of things,
Yeah.
if that makes sense.
And you know what? I completely agree with you. In a perfect world, it would make a lot of sense that there shouldn't be the need for abortion.
Mm-hmm.
Uh, but unfortunately, I don't think that's realistic.
Okay, so I have some questions then. So I was writing down some of your points. So what if abortion is killing an innocent human being? Do you think, like, generally speaking, do you think the government should be involved if, like, if someone were to kill an innocent human being?
When you say innocent human being, like I wouldn't categorize like a fetus as a human being. Are you asking about aborting a fetus or just killing a human like murder?
Well, that's what I'm saying. So, like, it seems that in kind of your opening statement, you were talking about how um, basically it was inhibiting personal liberty. But I think the problem is that if am I lagging? I'm getting in.
Nope, you're good.
Okay, good. But pretty much, if it is true that abortion is killing an innocent human being, then I think that the argument from personal liberty doesn't work. Primarily because, like, for example, if I go up to someone and I punch him just out of nowhere and I say, dude, you're impeding on my human liberty, I mean, we would think that's kind of, we wouldn't think that would be a proper justification for that situation. So, however, if the unborn life is a human being with natural rights, I think that the argument doesn't justify abortion.
I see. Yeah, I guess my rebuttal to that is that I don't see a fetus as the same thing as a living, breathing human being who has their own uh who is their own person.
Hmm. And that,
So so
oh, did you want to go ahead? Sorry, I didn't want to cut you
yeah,
off.
so what it comes down to for me essentially is the I guess cost and benefit of an abortion. If the mother is suffering, like that's a huge cost.
Hmm.
And I wouldn't want to make that mother suffer whatever they're going through. I would allow them to go through an abortion, especially since depending on the stage that it's in, that the fetus is in, we can effectively call it a clump of cells, and it has no feelings, no consciousness. And yeah, it's not something we want to do. But in terms of like the amount of suffering, if the mom is suffering, then that's kind of the cost and benefit analysis that we need to do.
Hmm. So, are you familiar with postpartum depression?
Yeah.
So, my question is, so this is called walking a toddler. If so, let's say that hypothetically a child was born like comatose, which it does happen, or even born into a NICU unit, and the mother developed extreme amounts of like postpartum depression. Do you think like
Mhm.
that it would be justified to like post birth abort that child?
Mm-mm.
Okay.
First off, post birth abortion, that's just murder. Um,
Yeah, like
so
I agree
so I
with
would
you,
not want
but
that
like
at all.
okay, so like I I will be careful with the word murder. I would say that it's more accurate to say homicide just because like I think the definition murder
Sure.
says like unlawful, but and obviously well it's
Yeah.
legal, but like so I think the crux of the argument for either of our sides is like you also mentioned things like better healthcare, sexual education, parenting resources. Is that I think though even if I granted all of those things in terms of like healthcare, like let's say that we just complete nationalized healthcare and that we provided those things, would you still be pro-choice? Like we shouldn't have the government involved in limiting abortions?
Okay, sorry, just to clarify, you said if healthcare is universal?
Yeah,
Or-
if we have nationalized universal single payer healthcare, like and let's say that women can get free services like Planned Parenthood, like I just concede to that, and like they get sex education and so on, would you still be against making laws that inhibit abortion before the 20-week mark?
I guess I'm a little confused. So you're saying like the the mother gets full control over the decision.
Well, what I'm saying is that you were saying that pro-choice policy is good because it's typically accompanied by better healthcare, better sexual education, and better parenting resources. And I'm asking you, like, if we did all those three things, would you still be pro-choice?
Yeah, absolutely. Because and I think I mentioned this too. Even with all of that assistance and support, there's still a lot of cases that are out of people's control that would still cause suffering. And that this goes back to like in a perfect world, if there was no abortion, that'd be awesome. But in reality, like things happen out of control. Like the fetus will sometimes just be inviable for whatever reason. There are ectopic pregnancies.
Mhm.
There are a lot of things that can, even with all of that extra support, warrant in abortion.
Okay, so
And if you want, I can get specific into like the type of regulations.
mhm,
I would,
support.
yeah.
So would that be, if I am correct, it is um, abortions before 20 weeks with medical exceptions and like rape exceptions, maybe?
With medical exceptions.
Like,
Sorry, I'm still confused.
so pretty much no abortions, okay, before 20 weeks legally. However, there's medical necessity and also rape exceptions. Would that be your position?
I think I want to use the term elective, but that's a very kind of loose term.
Okay.
Um, I you know, so here I'll tell you what I think. I have it written down. So there's a point where women, mothers who are pregnant, can be given a pill,
Hmm.
and they have heavy flow, and that effectively aborts the fetus. I think that should be completely elective. Okay, the people who are involved in that are the mother, the father, and those are the people who make the decision and bear whatever consequence as you see it. Um, and that goes up to about 12 weeks, obviously case by case. But and then we get to 20 weeks, and that's where, like I mentioned earlier, it's possible for that fetus to survive outside of the womb as its own person. So I think that gives the fetus at the point a lot more value, um, and I think that should be medical necessities. Uh, Medical necessities, as in cases of rape, in case of fetal inviability, ectopic pregnancies. I mean, those would be dealt with earlier. Um,
Okay.
if the baby's not doing too well for whatever reason, if the mother's sick, did I say rape already? Rape,
Yeah.
stuff like that.
Okay. So just
And
so
obviously, life of the mother. And then,
yeah.
oh, sorry, last thing, but between eight, 12 and 20 weeks, the point where it requires kind of an invasive surgery, where it's a DNC, a dilation and curettage, or whatever the other one is. I think that brings in the doctor, which I would argue that the doctor might not like that, based on their beliefs, and it might cause them suffering to perform the surgery. For that, I would say let's give them the option to opt out of performing the
So
surgery in respect to their views.
nurses and medical professionals can opt out from performing abortions, pretty much.
I think, yeah, if you're involved, and this I'm not like super firm on. I just think it's important to consider the views of the doctor at times.
Mm-hmm.
And obviously they give an oath to helping people. So this is why I'm not firm on this, because I don't know like how doctors and would feel about it. But just to pose that perspective of caring about the doctor, I think maybe giving them the option to opt out of it, or and including the other people who are working on the surgery.
Okay. I think that makes pretty pretty decent sense. So basically elective before 12 weeks, and then after like 20 weeks consciousness and viability, only in cases of medical necessity and rape, and then you're kind of agnostic on whether doctors or whatever should be compelled to provide abortions.
Yeah, yeah,
Okay.
I think agnostic is good work on that. And then 12 to 20 weeks, I think that should also be elective, but also I feel like there should be maybe consideration, and for every single one of these moments, whether you're getting an abortion at 6 weeks, 12 weeks, whatever weeks. I think it should be required to talk to a doctor, and because a lot of people in these situations just lack the education, and they show up at like 20 weeks and they're like, I don't want this or whatever, and like that's an issue. Um, these people should, make sure we should make sure that they're getting the information that they need. All that.
Okay. So now I'm going to kind of attack your logic when it comes to,
Mhm.
so with viability, I think there's a big problem whenever you talk about viability. First of all, which viability was originally like a compromise between the pro-life and pro-choice positions under Roe v. Wade, but also um, viability can be different between hospitals. Like, and the reason why is so whenever a child is put into the NICU unit, the main determinant factor of that is how mature their lungs are, so they can be put on ventilators and so on.
Mhm.
So, like, for example, a child would not be viable, even if it was like 30, 40 weeks along, if the hospital doesn't have a ventilator, technically. Or, like, the point of viability from 1970 changed from 2025 just because of advances in medical technology. And I think the fundamental problem too with this logic is that we as human beings, like whenever we take the child out of the mom's womb into the real world, I think that's literally just a change of location because the womb, like the umbilical cord provides blood from the mom via the placenta, it provides nutrition. And then literally when we take it out in the real world, we just hook it up to what's called TPN or total parental nutrition and we feed the child and also we give it oxygen through the ventilator. So like I'm having trouble like understanding like what is the moral significance between the two in terms of viability.
Yeah, that's a good question. I think first off, like in the womb, the baby's not even using its lungs. It's not even using its heart fully. So I think those two things are important. And when I say like I mentioned before, like this baby is its own person. It can function, um, effectively on its own, obviously with the help of a ventilator in that case, but um, it is no longer reliant on the mother. Um, so, like I said, that's kind of like I would describe it as its own person. And um, I'm also a little confused on the point, I guess, of this questioning when it comes to viability after 20 weeks specifically.
My point is that you're so like whenever you even talk about exceptions and stuff like that, like
Mhm.
my I'm focusing on your more criteria of what you define as a person. Because for example, I the main problem with it is what's called over inclusion or over exclusion principle. So like whenever you talk about viability in general, like it's not reliant. So if we take the word reliant to its maximal conclusion, like a born child still needs to be breastfed, it needs to have its diapers changed, and then that results into, well, it's not dependent on the mom's body, but the mom still has to feed said child to provide for it. And kids in the NICU or neonatal intensive care unit still might need people to provide services to that child. So like if we're going to accept that it's okay to induce or end the life of human beings in the womb because of reasons XYZ, why wouldn't it be okay to do the same for these other human beings for reasons XYZ?
Yeah. Okay. I see what you're saying. And I think the big difference, or I guess two big differences. Once outside of the womb, the baby then has its own kind of consciousness where it has its personality. Its consciousness gives it personality and all that stuff. And I'm just going to describe that as personhood, as I keep mentioning.
Yeah.
So that on top of what I mentioned earlier, like the heart and the lungs are now working, and also the mother isn't like a consequence of the baby, right? So like a mother with the fetus inside of them, like they're one of they're one of two I don't know how to say it, but like the mother um may have suffering from the baby, but if the baby's outside of the womb, then the baby doesn't affect the mother.
Not as much, but like you like for
Well,
eight
once the
for
baby's outside of the
okay,
womb, the mother is not required at all.
required at all to not end the life of the child though, right? Like you can't just leave your baby in the middle of the woods, right?
Right, right.
So
But like
like
I
you
said,
do
what I
have
mean by that,
duties to the child. Like
yeah, absolutely. But the mother isn't at risk
well can
of
well if a child had COVID and put his mom at risk, would it be okay to harm that child?
no,
Okay,
no.
so even if the mom's at risk, then like it wouldn't be okay to harm the child.
Um, even if the mom, sorry, I'm just like confused.
Well, what I'm saying is like basically, so you brought up consciousness, which I also would want to. We can talk about neurological conditions later, but basically, if you're going to talk about the risk of the mom, is that there is cases of self-defense. Like for example, like if I go up to you and I'm like, "Yo, bro, like I'm mad at you," or some if we had some dystopian world where fetuses crawl around and go to attack mothers or something, maybe you could say like self-defense, but the child isn't aggressing, and I say that because a born child can develop illnesses, whether that be the flu, COVID, or any illness that puts the mom at risk. And if you're saying that the mom can cause a sequence of events that cause the death of their child, that logic would also have to apply to born children.
I see what you're saying, but if the child is sick, there's no guarantee that the mother is going to suffer. You know what
Well,
I'm saying? But if the fetus is physically inside of the mother, then the suffering is coexistent.
mhm,
Does
sure.
that make sense?
Well, I see what you're saying that like basically the child is physically attached to the mom, and this isn't to downplay
Right.
pregnancy. Like I agree that pregnancy can have a lot of weight, but the thing is that 9 months of pregnancy can have its host of problems. But you're also
Mhm.
talking about 10 to 18 years of problems after. And if we're talking about the action of the right to terminate or end the life of another human being, is that the threshold of suffering would also be very ambiguous. For example, like I think in my view, like I mean, I'm not utilitarian, but like if you're going to say suffering, is I think that all relationships have some level of suffering. Like, if
Yeah.
I, as I said, if I change diapers, like if you're breastfeeding your child every day, like if you're staying home with your kid, you are suffering. However, we would not say that gives mothers the right to snuff out their children if they have postpartum depression, postpartum psychosis, or something like that.
Yeah.
So I would just extend that to yes, there is suffering, and we can help mothers with that through non-lethal means.
Um, yeah, through non-lethal means after birth, but something you said was that the line of suffering is ambiguous, or the threshold of what's like suffering is ambiguous. I don't think so. I think that the specific cases that I'm thinking about, like after 20 weeks, those are all extreme cases that require and warranting a medical necessity.
Mhm.
So I think the threshold for suffering in these 1% of cases after 20 weeks is always extreme and always necessary.
Okay, so I could get into the threshold, but
Like I could say like
I'm just curious. So if a mother
Mhm.
was 8 months along, the child could be born like via cesarean section, or like a labor could be induced, and then so she's dilating, and she
Mhm.
says, "I was raped." You would be okay with an abortion at that stage?
No, it's already happening. Like,
Right. Well, that's what I'm saying is that if you're going to apply the medical exception past that point, don't you think like, for example,
well,
like
within reason, obviously.
we agree rape is wrong, should be illegal at that.
Yeah.
So that's good. But but what I'm saying is that so in your view, already at 8 months, you already are saying like yes, and like in your opening statement, you're like we shouldn't force birth on people. Yet at 8 months, it's like okay, it's already happening or whatever. So under your own position, you would be technically forcing someone to give birth.
Obviously within reason. Like you don't physically have the time to even discuss an abortion if you're giving birth. You know what I'm saying? So I think that's unreasonable, and it just wouldn't happen in real life. But I understand you're
You're staring.
testing my consistency here.
Yeah, you understand like what I'm trying to say, where
Yeah,
it's like
yeah, yeah.
basically, I'm just taking the position where I think the root of this problem isn't viability, or even like those exceptions, and even primarily because I think rape is evil. I think we need stricter charges on rape, particularly in the United States. I
Absolutely. Yeah.
like absolutely like but also I don't think that an abortion necessarily fixes a woman's rape or unrapes her. And whenever we talk about abortion, every time I talk to people, they'll be like, "Oh, I would not support that at 8 or 9 months." And basically, what I'm saying is like, okay, I'm just taking it a step back, a step back, and step back, because I think that a person becomes a person whenever at conception, because as I said, it's just a difference of age. And back to my main point, that I think the main crux of your argument is this idea of consciousness developing at 20 to 28 weeks, or if I'm right, like some capacity to suffer.
Well, to be clear, the fetus inside the womb doesn't suffer. It doesn't feel anything. It may react to things physically, but it doesn't have a conscious capacity to feel things. So I wouldn't say it's the suffering for the fetus, but the value in its ability to survive outside of the womb. I think is like at that 20-week threshold is my important contention there.
Okay, so ability to survive outside the womb, like, is the reason why, like, because as I said, the baby is literally just inside the mom's, like, and even when children are born, they're still attached to the mom via the umbilical cord. Like, so if a child was born premature, and here, let's do this. If a child was born premature at 24 weeks, do you think that child would have a right to um, options to try to resuscitate the child?
If the fetus was born at 24 weeks,
Yeah, it was born.
sorry, say again.
yeah, it's a
Prematurely, yeah.
prematurely, and like let's say that it had um, it's called dyspnea, but like difficulty breathing, and that it needed a
Yep.
ventilator to survive outside the womb. Would that child have a right, or basically, would doctors be compelled to provide life-saving care for that child?
Yeah, absolutely.
Yeah, and that's what I'm saying is that so that child in that situation did not have the capacity to survive outside the womb unless you intervened.
Well, yeah, like even full full term babies still have difficulty outside the womb, you know?
Yeah, and that's what I'm
This
saying
is,
is that
like
I don't.
we don't have babies and then just like leave them there.
Mhm. Yeah, and what I'm saying is that if your criteria for okay, not to kill is if it can survive outside the womb, I think that basically is that
I
if
see.
it cannot survive outside the womb, then we would be obligated not to provide care for it. But we
I
obviously
see
have
what
the
you're saying.
intuition like we can.
Yeah, so I just want to clarify, I guess, then. So it's not just the fetus's capability of surviving outside the womb, but it's that versus the mother's suffering. Does that make sense?
Yeah,
So preferably after 20 weeks, in most cases, I don't think abortion should be allowed, but in extreme cases when the mother is suffering significantly, after 20 weeks, abortion should be allowed, like in cases of rape and it just specifically on rape, because we kind of talked about that earlier, so I kind of want to just follow through on that. But I think there's a lot that gets downplayed on the mother's suffering of having the child versus not having the child, because if a rape victim is forced to have their child, the child of the rapist, then what happens? Does that woman now raise that child? Do they live with that child? They have to think about that child. They need to look at that child's face and see their rapist face on there. Um, and
yeah, I
there's a lot
completely
of
I understand your
effectively, yeah.
emotions, what you're saying, but what I'm saying particularly is that you've already conceded to the point that at some point, if the child is already coming along, that isn't significant enough to terminate the end of the life of the child. I think that we can help women in those situations, but I don't think that, for example, also I want to say that abortion limitations are not a positive duty to get forced to give birth because birth is literally just medically defined as the child emerging from the uterus or moving from uterus to the outside world. So basically, that would mean that like even if you terminate the life of the fetus and it comes out, it's going to be born regardless. So my thing is that the woman can see that and there is options like adoption, but what I'm saying is the suffering a person experiences, if that justifies terminating the like the human life inside of you, then you would also, I think, have to apply that logic to human life outside the womb. Like, for example, if you had the 1 or 2
Okay,
year old and you're like,
can I
I'm
jump
so,
in?
yeah, okay, go ahead, yeah.
Yeah. So okay, yeah. Distinguishing inside the womb versus outside the womb. Whereas, like, what if I'm going to apply the okay? Well, then they should be allowed to be aborted inside the womb under extreme cases. Why can't we abort them outside the womb in extreme cases? Is that kind of what your
Yeah,
point is?
that's kind of what I'm saying is that like if suffering is so grotesque, like that a mom is just ultimately depressed because let's say that she has a 1 or 2 year old and her husband leaves her, she has no money to provide for the child, and now she's just like in a poor neighborhood, and she's like she looks at her child and she's like, oh my gosh, that is literally like the person who wronged me, and like she smuggles her child. We were like, oh my gosh, she just committed homicide, she murdered that child. But the logic completely flips whenever that child is literally younger in the womb.
I don't think it flips because the reason why I'm okay in extreme cases with abortion after 20 weeks is the fetus inside the womb doesn't feel anything. Okay, so I'm still considering the potential of the fetus, and which is why I'm requiring the abortion to be only under extreme cases. But the fetus doesn't feel anything, and outside of it, it absolutely does. It absolutely feels all of that. That's murder, and that's a big difference.
Hello, you're lagging a little bit. Can you hear me?
Oh, yep, I can hear you.
Okay, so
Repeat that last part.
test. Can you hear me?
Yeah, I can hear you.
Okay, awesome. So basically, my question is, so I wanted to bring up this hypothetical. Do you know what hydrocephalus and encephaly are?
Hydrocephalus, ancephaly is like no, or like a diminished brain. Hydrocephalus is like the spaces between the brain are like really big or small or something.
Relatively. So basically, so like ancephaly is children are born only with their brainstem. Okay, and
Okay.
basically they're severely disabled. And hydrocephalus is basically like the during pregnancy, the brain fills up with or sorry, the headspace fills up with fluid, and it causes the child not to develop as much as their brain. So the child is going to have some level of diminished consciousness, if even a same level of consciousness that we have right now. And as I said, the pig has can recognize itself in mirrors at um, the pig can recognize itself in mirrors. So my question is that in the cases of hydrocephalus and encephaly, if the child does not feel pain or suffer the same, would you be okay with terminating like that child if it doesn't experience that?
Well, it does experience pain,
Well, not the same way you and me do. Me and you and me do.
right? But it still experiences it, right? It still has an experience, period. But a fetus in a womb does not.
Okay, so like first before I go to the experience part, so whenever you talk about basically like the ability to feel pain, if you gave pain medications to the child before you killed it, you would agree that's wrong, right?
Well, yeah, I wouldn't want to kill it, period, just because it is what it is, you know?
Okay, so that I think that's important. What is, and I think what is the child is it's a human being from the beginning, and I think that as I said, so at some point I think you recognize that it develops an experience, and that this experience, in your view, is what you think is valuable and worth protecting. However, I think the problem is that we have the severely disabled people who have a diminished experience regardless. But let's say hypothetically, um, you could administer a medication before the 20-week mark, and the child never developed like consciousness. It didn't develop the brain the same, and it never experienced it. It was like sedated or something like that. But the child's body grew like just the same. And if we stopped giving the medication, it would go back to normal. Would you say it would be okay to terminate that child?
Okay, so I need to clarify. So after birth, we give it medication to do what?
Okay, so here, let me clarify the hypothetical because I was kind of
Yep.
yapping a lot. Sorry, but
You're good. You're good. Yeah.
but pretty much. So 20, let's say 20 weeks is when it develops consciousness. Beforehand, let's say at like 18 weeks, you give a medication that prevents it from ever experiencing consciousness
Sorry. This is while it's in the womb or after.
when it's in the womb.
Okay.
So in the womb, it will not experience consciousness unless you stop giving the medication to the child. And the child still continues to develop past this point, okay? And the child over here is born. Would it be okay to terminate the child if it never had that criteria that you're talking about?
Well, I think that is, frankly speaking, an unreasonable hypothetical. Um, just because with kind of the artificial influence, well, that seems like it would be an entirely different like conversation. You know what I'm saying?
Well, the
Like that's
artificial
like not a
influence.
naturally progressive thing that happens.
Well, the thing is, though, is that if you have a problem with the artificial influence here, before it develops that, why would you not have a problem then with the abortion that happens before the 20-week mark?
Okay, so the pills stop brain functioning,
They basically stop the child from developing the brain the same, and it does not experience consciousness.
and you continue giving that medication up until birth.
Yes, and it's born, and you can stop taking the medication, and the child will go back to normal. But it never experienced consciousness. Would it be okay to kill the child?
Inside the womb, it doesn't experience consciousness.
Well, what I'm saying is if the child was born and never experienced consciousness, but it developed like a
Like
human.
after birth, it never had consciousness.
Yeah, but it's still like alive and growing. It's that the pill, you could take that away and it would still, like, it would go back to normal. Like, would you be allowed to terminate it?
Okay. So like, okay, continuing the hypothetical, like, oh, let's give the pill for another year after it's born, right?
A convenient
And
time of
then,
9 months. No.
yeah,
But basically what I'm saying is that
I
it
think I'm
seemed,
understanding.
yeah, pretty much what I'm getting at is if we recognize that, like you mentioned earlier, that before it developed the consciousness, that we basically, it's like, oh, that's weird because we're intervening. But an abortion is an intervention before that, and it denies the potential past the 20-week mark. And you intuitively
Mhm.
recognize that there's something wrong with that. But then, whenever we talk about, like, basically an abortion at that time, you say, it's a little icky, but like it's still okay if someone chooses that. But the medical intervention would still be like a weird hypothetical.
Right. So if we have this now infant after birth, still no consciousness,
Yeah.
that's, and I feel like I'm going like coming full circle, coming in circles, repeating the same thing now, but it's different once again because there's no obligation. There's no obligation to the mother's health, right? I would not want after 20 weeks abortion at all, but like I said, only for those extreme cases. Okay. And those extreme cases are warranted because of the mother's suffering. But if we have this now child born and it still doesn't have consciousness, there's no reason to homicide it because no one is suffering
Murk
from
the
it
child.
being, yeah, there's no point in murking the child
Okay.
because no one is suffering from it. Does that make
Uh,
sense?
yeah, okay, so basically no, because it does not cause the mom to suffer, pretty much. Like the
Right.
answer. Okay, all right. So reason for, so now I want to talk about the basically, I used the hypothetical. It was actually in the debate between Trent Horn and Destiny. If you watch Destiny, it was a little bit modified, but basically, so now when we talk about suffering and medical necessity, we're talking about like 1% of abortions. But basically, my question is: are you familiar with what's known as the principle of double effect?
Mm-mm.
So my best summary of it now is, I mean, you can research into it. It goes back to Aquinas. Is that, so in Catholic hospitals, if someone has a medical condition that like needs procurement that could harm the child, basically what they would pursue is that they would pursue a treatment that targets the illness without directly going after the child. Basically, so like
Mhm.
as you brought up with your cancer treatment in your hypothetical, we would not
Mhm.
blast the child with radiation to
Right.
like stop it. What you would do is you would undergo chemotherapy and radiation treatment and cautiously not go after it. So the treatment has the positive effect of it, but also may have negative effects. So it does
Okay.
not, it's not intentional, and it's a secondary effect. Like, do you understand that logic there of like what I'm trying to say?
Yes.
So basically, whenever you go to a Catholic hospital, they don't offer abortions, but like a woman who has like sepsis or something like that, usually they'll get it confirmed, and then like I think there's an interview with Dr. Monique Rubera where they're talking about medical necessity and abortions. If you want to check that out, but and I think Dr. Anthony Levatino also talked about it. But basically, is you can get treatments for that thing, and it might be a secondary effect, and it might come unfortunately to that, but that is not the intent of the treatment. Where, like as I said, you're not killing the child to have a better
Right.
outcome.
Right.
Like, so when
It's
you talk,
essentially accidental.
yeah, accidentally, where it's like it would be avoided at all costs, and like it's used
Right.
even in
Right.
like, for example, like in wartime ethics. I think it's like just war, where like for example, there's a difference between like intentionally attacking another person and then basically like casualties as a result of said action. You see what I'm saying? Like,
Yeah. Yeah.
yeah,
Caught in the crossfire.
caught in the crossfire, pretty much. So like whenever we talk about medical treatments, and I think you brought up here, let me, um, So sepsis is that I can actually send you. There is studies about the proper way to manage sepsis with the principle of double effect, where we can help women who have that. And usually the treatment for sepsis, by the way, and you also brought up a case of hemorrhaging where she was bleeding out. Sepsis is usually treated by IV fluids and what's it called? Antibiotics really fast. And hemorrhaging is usually
Mhm.
blood cross matching and stuff like that. So whenever we talk about a woman who is pregnant with those things, usually like they wouldn't prescribe an abortion, especially later in term, because it can be very strenuous on the woman's body. She has to dilate for like 3 days at certain times because
Right.
like the baby's so big.
Just to jump in real quick, just to because like it has to be this way, it has to be that way. I don't disagree that those things happen and like those decisions are made, but everything is case by case. So I just want to be careful not to generalize how everything's supposed to go one way or another because it's different with every person.
Yeah, I agree with you, but pretty much even in hospitals, like they have ethics boards where they do have policy. But I wanted to bring up the one thing you did bring up, Amber Thurman. Do you know what Amber Thurman's actual cause of death was? Like her,
Um, yeah, it said yeah, she apparently bled out.
well, basically, if I'm correct, is that she bled out, but primarily the complication that led to that was so whenever she traveled, and hopefully I'm correct whenever I say this, but when she traveled to another state to procure an abortion, is that she induced an abortion and basically the remains were inside of her and she developed pelvic inflammatory disease and then she eventually died from I'm pretty sure a septic infection because the DNC so they give pills to like end the life and then they take the DNC to remove the contents out of the mom, and if I am correct that she died because the contents were not removed and she did not receive an abortion. You see what I'm saying?
She didn't get yeah, she didn't get. I'm reading it right now, and I can provide the link if you want me to.
Yeah, sure.
Um, how the heck do I put it in chat? Ooh.
Chat,
Yeah,
Jamie, pull that clip up.
I'm just gonna send it to your direct message. I don't even know.
Okay, I'll check it out then.
But yeah, so she didn't receive the DNC.
Yeah, and what I'm saying is that if you're going to blame if you're going to blame um like her death on pro-choice policy, I'm sorry, pro-life policy, is that you'd also have to accept the fact that the reason that she was also kind of in the situation was, or she developed pelvic inflammatory disease, was because she did abort her child. You see what I'm saying?
So you said she aborted the child. What do you mean by that?
Like basically, so there's abortion procedures like DNC or DCE, but if we're defining as abortion as the termination of the unborn life in the womb, then basically she took medications to cause the death of the child provided to her.
Okay, yeah. So she personally took medications. Yeah, that's true.
Yeah, and basically, so if woman is pregnant and has baby inside of her, and baby is dead, dead babies accumulate bacteria while the uterus is otherwise sterile. So if you do not remove the dead child, like and this is brought up in miscarriages, that the woman will usually go into septic shock or have other problems. So she travels to another state, takes pills, baby dies, she doesn't get the DNC, the issue is blamed on pro-life laws. You see what I'm saying?
Yeah, and I think that makes a lot of sense because she had to travel out of state in the first place. She shouldn't even need to travel out of state. You know what I'm saying?
Well, what I'm saying though is that technically she also wouldn't have died if she never have taken the pills to abort her child.
I mean, yeah, that's true, but abortion's going to happen no matter what. People are going to find a way. They want these things, so better to have healthy abortions in good health care. Um, if she's willing to travel out of state, when she's however long pregnant or whatever, and get this done, and she clearly wants to talk to someone about it, we should get her that help because maybe someone talking to her about it could also present her with other options. hey, maybe instead of aborting it, maybe you want to have it and we can put the baby up for adoption or whatever. You know what I'm saying?
Yeah, I know what you're saying. So my thing is that would you say that it's safe for the mom or the child in the womb?
Or what?
Well, like what I'm getting at is like we're saying that it's okay to get an abortion because it's safe for the mom, but it's not safe for like it's safe for the mom to procure a safe medical treatment, but that safe medical and treatment literally entails that the unborn human will die. But like that's a safe treatment.
Yeah.
Like
Well,
for
yes,
which for
that's
which party involved is it safe for?
that's the that's the cost and benefit analysis right there. We need to take these case by case. You know what I'm saying?
Hmm. I,
Like we need
I
to know her reason. Like I don't know her reason why.
and what I'm getting at is like so like for example, if we take other laws case by case, like for example, I mean if someone steals, if someone even unalive someone, like oh my gosh, I use TikTok language. I sorry, brain rot. But like if someone kills someone like in real life, we don't just I mean we have due process, we have all those things, is that we can still take that case by case by having restrictions like on abortion.
Yeah, but having those restrictions, yeah, I mean, yeah, we still take it case by case, but there's a lot of constraints. There's a lot of constraints on the availability of care. Like in her case, she had to go to a different state, right? And also, there's a lot of restraints on the doctors themselves, where they're like, shoot, can I even do this? Because the law is so strict, right? The law
Hmm.
is so strict that they have to worry about, they have to put their medical license before people effectively.
Yeah.
And
And
that's a really crappy position to be in.
yeah, I think though like medical professionals, I think you can get at where medical professionals should be educated on something, especially like new or even controversial policy. But I it that kind of already happens though. Like as I said, is that
Yeah.
like it we have guidelines like after even the 20-week mark, like later term, because like this is something that is more research and you can get even I mean there's plenty of studies of I would say most of the studies favor pro-choice, just to be honest, whenever it comes to like medical necessity. But I would say that if you actually get into like um, treating these conditions, is that there's already guidelines in place that we can modify and stuff like that. But if we're going to go after abortion, is that we can make restrictions and then whenever we see it, we can talk about okay, here are the guidelines physicians and nurses need to follow here. These are the guidelines that follow here. Is that like we can still take caution to like make sure that people receive good health care whenever we make pro-life policy.
Yeah, that's true. And you know, like doctors, I'm sure, just like any other healthcare worker, they re-educate themselves, you know, all the time and update themselves on the laws. So yeah, obviously that happens. I think still though, it can be a little difficult, just because how strict they are. But also, that's not the only thing that's
I agree.
restrictive.
Mhm.
You know, I'm going to go back to traveling outside of state again, um, and there are other restrictions that vary between states. Um, and you know, in some states, you could what is it? Um, you could rat on people and be like they had an abortion, and like
Yeah.
you'll get arrested or whatever. Like that's crazy.
Hmm.
Um, in my opinion. Sorry, I don't mean to to
No,
phrase it that way.
no. Just be honest,
But
sir.
like
No.
it effectively what I'm trying to say, it's the compounding amount of all of the restrictions, um, that especially causes a problem. Um, but also I want to question you on some things here,
Okay.
um, because you say life begins at conception, which I agree, life does begin at that point. But I don't personally attribute value, um, or like as much value at that point as say you would. So why do you, or I guess, do you see like a single-celled zygote as equal to a human being?
Equal in the sense that, like, for example, like we shouldn't kill the zygote.
Yeah, like if I'm saying like, okay, like this zygote is equally valuable to a human being, is uh murdering the life of the zygote the same as murdering a fully grown adult.
Relatively, I would say that um, yeah, I mean it carries some, I would say, a pretty significant gravity when it comes to killing a human zygote. Yeah.
Okay, so you say relatively, so there is some difference.
Well, yeah, and the reason I say that is because like even if like for example, usually these are like when you talk about like IVF clinic scenarios where like would you save is that I mean you can talk about um like I think the culture component does play a factor where I think that like a zygote has different needs in the sense of like for example if we even apply triage principles like for you and me and I went up to your dead body and I saw that you had pinpoint pupils and like you had spinal fluid coming out of your ears and then you're like does that person have the same value as like the other guy that you can save and I'm like well like they're both human beings and I think that ideally we should be able to help both of them. However, is that like to kill both of them? I mean, that's another jump. And I would say that the same is for a zygote. Like, is that
Okay, I see what you're saying.
like basically that, for example, I mean, in there was actually this is an interesting thing. There was I think in California or whatever where so these terrorists straight up crash into an IVF clinic to
Yeah,
liberate
yeah.
the embryos, and then firefighters actually like rescued the embryos. And what I'm getting at is like if we're going to get at like should people be obligated? I think that people can be obligated to help, but then there's the means to do so and then there's also like what's it called? You see what I'm getting at here a little bit or
So you're saying there's something that gives the fully grown adult more value than the zygote?
no, I'm getting at that um when it comes to killing is that all human beings are worthy of not killing and so on without just cause like for example if they're aggressing like self-defense. However, I'm saying that different situations when it comes to the individual needs of a patient or human being might need different procurements.
Okay, so it seems like depending on the situation, you would place more value on a fully grown human than a zygote.
I would say that it would be more along the lines of I would put more value on the kind of thing that would be easier to save.
Okay, because it sounds like me what you're saying. Depending on the circumstances, I would prefer to save a fully grown person over a zygote, a single-celled zygote,
You might be
which
because I mean
which makes me
I don't usually carry around a giant freezer or like I like that's what I'm getting at like
yeah, yeah,
it even like if you had as I said this is triage where it's like black tags, red tags. Like
right, right. But
if there's a human being and you're like, "Oh, do you think disabled human beings have less value than this other person because I mean, you wouldn't save the person with a lung condition over the healthier person. It's like, no, I don't think I should go up to them and cause their death. However, I think that if we're talking about a respiratory situation, is that we would have to take those factors into play.
okay, I feel like that's still because like at first they asked about like the value, and you said zygotes are relatively or there's relatively
With
different levels of value,
I'll say
which
this
makes me
with nuance, I'll just say yes. I think that they're equally valuable. Yes, with nuance. The same way with other
okay.
people.
With exception, yeah, I just don't understand like the importance of like a triage case because that's like
Well, we apply it with people, like you and me. Like we apply it the same.
right, right, absolutely. But like I think actually there is importance to that because if we're triaging the mother and the zygote, see what I'm saying?
like I would say
So
that
if the mother is
the
suffering to an extent, we could prioritize her over the zygote that has no suffering.
well, the as I said, the ideal is that basically you would
And
prioritize both, like you would save as many human beings as possible. But like for example, if a mom gave birth in the
you would
middle
choose the one, if it's like a one-on-one, you would choose the one that has the better chance.
of
And I
survival,
think that
yeah.
fits my perspective very well about why I'm pro-choice is like we're prioritizing the mother over the zygote in these situations, right?
Well,
So I think that is
you could
pretty much the same
prioritize.
thing.
I mean, it depends because you could prioritize. I think the equivalency principle still stands where if you're talking about abortion where you can't kill that, for example, if we had a mom who gave birth preterm um, in a cornfield, and like let's say that like if ideally if we could save both of them, we would save both of them. But if we don't have the immediate technology available, is that we might save the mom. But if we had the technology available and then we didn't do it, that would be negligence.
Right. And in abortion cases, if there's an ectopic pregnancy where, we can't save the fetus, but we can save the mom, like we're gonna do that. So I
So
think that fits
so when we
the
talk about I don't.
pro-choice narrative pretty well.
Okay, sorry for interrupting, but basically when we talk about ectopic pregnancies, is that it depends on what treatment you're offering for ectopic pregnancies. Because as I said, they ectopic pregnancies are not documented or coded as abortions. Primarily, even as I said, I use Catholic hospitals because they're a good example. Is that the principle of double effect would allow for you to pursue something like a saponectomy or saponotomy, which pretty much just means they cut
So
into
you're
the
saying there's alternatives to just abortion.
yeah, and it would still fall under those moral principles that I laid out earlier. But then Catholic hospitals would not allow for you to induce methotrexate, which would intentionally go after the bodily integrity of the child to kill said child just to save the treatment. It would pursue a treatment where they would remove said child in hopes of that, like, if we take the child out of the bad situation and that if we had the technology to save the child, we could, but we don't have that right now, if that
I,
makes
I
sense.
I think that's fair. Like if there's a possibility of not aborting an ectopic pregnancy, and you want to see if you can do it, save it, then that's perfectly reasonable. However, and I want to rebut with two things. One, that's not always the case. A lot of the times, ectopic pregnancies are not viable, period, and will harm the mother eventually if nothing is done about it. Um, but also, if you want to do that, you can do that under pro-choice laws. If you want to do the alternative Catholic, whatever, um, that's your option.
Well, my concern is that whether we're just killing unborn humans for like a positive effect versus we're doing actually like what would be morally justified, I guess is what I'm saying.
Right. And I understand that. And like I said, like if you want to do it, go for it. But like most cases probably wouldn't be able to do that. It probably wouldn't work.
Yeah. Um, as I said,
But no, I think that's reasonable.
I what I'm saying is that like as I said even earlier is that if we're talking about ectopic pregnancies, that would be like the last on my list. I think that like the first on the list would be like doctors who like abort like children after 20 weeks who then sell their organs. Like I think we both agree that those people should kind of get priority of stopping them, especially if it's like in your view after the 20-week mark.
Someone aborting a baby and aborting a fetus and selling its organs.
Yeah, seriously, look up. There is videos of, I think it's in Texas, where they have undercover cameras where they'll, like it. I mean, it is a little bit more conspiratorial, but like it definitely does happen. Where I think there's even a picture where they froze conjoined twins with each other to then study
Yeah.
them. Like,
Not to cut this short, but I think we both agree that that's bad. Like
yeah,
I don't think anyone wants that.
okay,
Um,
that's good that
but
we're
but anyways,
sane. No.
Yeah, I want to poke and prod more about the life begins at conception idea. Is it a religious reason?
I was actually pro. I am religious, but I was pro-life before I was religious.
Okay, so what is your reason for giving such significance to, like a single-celled zygote?
Is a human being.
Okay, in what sense?
It
What makes it a human being to you?
is a member of the species Homo sapiens.
Okay, yeah, like the cell it's a single cell. So what, because it's part of the Homo sapien species?
Well, yeah, and that's what I kind of got at my opening statement is that I think that at conception, a new member of the species Homo sapiens begins to exist, and that basically that human being has potential to grow and develop with time, water, and nutrition, and that human life is unique, whether you want to pursue the religious option of basically we are made in the image of God, or you can even use a secular argument that our rationality is different, or that there is a unique trait of human existence that separates us as a kind of being from different animals, pretty much.
Okay. Just to be clear, so your reason is not religiously based, because you said before you had the
Well,
same.
my reason now is religiously based. It's just that I usually whenever I argue with people, I to convince people to the other side, I use the secular arguments because usually if people hear image of God, they kind of recoil. And I'm not saying that if someone does believe in God, I think it even in my own experience is that usually if an atheist or someone agrees that human life begins at conception, usually they kind of fall down that path eventually, kind of like what I did. But like,
I see. Yeah.
you see
And
what
are
I'm
you,
saying?
just to be clear, yeah, what religion are you?
I am Christian.
Okay.
I've been Christian for
Um,
2 years. I'm
a few.
recent convert, but
So my kind of, I guess, rebuttal to that idea of like it's a cell that's a member of the Homo sapien, like my skin cells are also part of it. It's a cell, just like a single-celled zygote, and it's part of the Homo sapien species, right? So
well,
like,
it's not an organism
what's the
though.
difference?
Humans, well, skin cells are parts of organisms versus whole organisms. And by that I mean that, for example, like they even have, that's why many biologists agree, even though they're pro choice, that human life begins at conception in the sense
Yeah,
of an
yeah,
organism. And that there is different characteristics, like there's metabolism, homeostasis, if you want to get in that. But a skin cell will never, like if I have my little skin cells and I put like sugar and like whatever water in that little petri dish, it will never like it does not grow and develop into a mature member of a species like a human being does.
okay. So interesting point, but I would say, just because I want to distinguish things here, my single skin cell is physically and materially the same thing as a single-celled zygote. It is a cell with DNA from my mom and dad.
I wouldn't say
So
so.
so
It's a part of you.
well, that's just true.
Well, what do you mean? Like because I like materially like we're made of carbon and hydrogen or something or
Like it's a single cell with DNA from both parents, and that's the same as the zygote, right? So then what's the difference then?
well, are you saying that like I am because are you saying that I have the same identity as my parents? Because as I said is that you can have if you're going to say like I believe something new is created because there's a substantial transformation like that happens at conception. And like as I said, even if you get into gestation, like in embryology, it's like 20 weeks, 15 weeks, 10 weeks before what? Like it has the DNA, but I think like for example, if I take eggs and sugar and I whisk it together, like that's or even if I put flour like and I mix it together, that's batter. Like that isn't the egg or the sugar. Like it is mixed, it is fused together. And then that thing then performs actions that are unique and different already than these
Okay,
skin
so it's
cells.
so it's the actions of it, not materially what it is. So the actions is what makes it unique and important.
It the actions differentiate it of the kind of thing that it is, like what group.
Okay, so like what type of cell it is.
Well, what type of being it is, like its existence, like it's an organism.
Okay, so I guess I should clarify then. Like since you value at conception, the zygote will be single celled at one point, so therefore you value it as a single celled organism, which materially it's the same exact thing as a skin cell, right? So then the difference becomes, okay, it's not just the material aspect, it's not just the fact that pieces of DNA from mom and dad came together and formed a zygote, it's something else. It's the potential it has.
I guess I would say I would fight you on that. That skin cells are the same as whole organisms, but I mean
Well,
it's still, I guess,
they're not
as
exactly the same if we look at the molecules, but structurally they're both single celled and they both contain DNA.
sure, I guess, but I mean, I like animal cells contain DNA, but they're not human organisms.
Right, but my human cells, like, should I value my skin cells as equally as a single celled zygote? Just
I,
because you know what I'm
well,
saying? So you're saying like, oh, I value
are
this zygote
you are
even though it's
you
single celled, so
like
I should value my skin cells the same?
well, are you your skin cells, or are your skin cells part of you?
I mean they're part of me, but
Well,
what I'm
so
saying
so there's
is
a difference
you
between the
said
two.
right, exactly. But you said you value at conception. So it's a single cell. So physically it's the same exact thing as my skin cells. So it's not that
It
you
wouldn't
value the structure of it.
it wouldn't be physically the same then, though, because like even if
I
you
mean, we
say
can
that
call
it
it an organism, but it is physically
well, like if you're going to say that it's physically the same, is that, and then you're going to make a distinction between the traits and like what it can do, is that usually you would have physical differences that entail the functional differences, even in your case.
right. So it's the potential and functional future it has is what makes it different.
I would say that and intrinsically what it is.
But intrinsically, it's the same as any other cell of our body.
It's not though, because
How so?
you just brought up its potential. Like as
Right.
a,
That's the difference. So physically it's the same, but the difference relies in the potential.
are you saying that it's alive, like that it's similar in the sense that it's alive, like these skin cells, or I'm having trouble.
Yeah.
Well,
Yeah.
yeah, and that's why my argument was it is wrong to kill innocent human beings,
Right. But
not living beings.
but it make so I guess to me, I guess it makes no sense to value this single celled um thing when it's the same as my skin cells. Am I committing genocide when I scrape my face? You know what I'm saying?
Did you kill a human being?
I killed a human cell.
Well, my argument was human
I see.
beings.
I wouldn't consider a zygote a human being. A
What
human being is a living, breathing person.
what is a human being in your view then?
What I just said. So it's its independent person. It has its own consciousness. It's its own person, right?
So so my I'm not saying my definition, then I'll ask you for yours. But in my view, a human being is a Homo sapiens that has being or ontological status. So what would you said that you must have consciousness to be a human being?
Well, I'm trying to distinguish between like a fetus and after birth, an infant or a fully grown human or whatever. Yeah, consciousness matters, and yeah.
But so a human being, so if it doesn't have consciousness, what would it be? Like what is the life inside? Like if it's at, like, let's say,
Fetus.
what is a like there's different species of fetus though.
A human fetus. I'm not saying it's not a human cell. I just wouldn't say it's a human being.
A human being, so it's a human cell. So
And not to get like semantic. I'm sure there are like exact definitions of human being or whatever, but that's just how I would describe it as like
so basically you're saying that is a human being is identical to a person, and then a human cells like form at conception.
no, human cells come in different forms. But I would say like a zygote is a human cell, and as it grows into a
Who
fetus, it's made up of human cells.
who do the cells belong to?
Well, it's its own organism.
Well, yeah, and then that organism does the organism get a new identity at 20 weeks, like for example, like 19 weeks unconscious human being, or sorry, unconscious human cells becomes conscious human being.
No, no, no. So that's not the only thing I value, though. I think there's a distinction between like a fetus being made up of human cells and a human being, but that's not the essence of like what I value. I mentioned earlier, like at 20 weeks, there's potential for it to be a human being, which I think is important as well. Contrasting that to what you say, like at contradiction, I think it is the same value effectively as a human, which I is
Well, that's what it is, though.
confusing because it's a single celled uh it's just a single cell just like my skin is, right? So I'm not going to value like my skin cells equally to a zygote just because it's a single cell, just because they're physically the same, right? Like there's nothing um like there's no potential in a zygote in itself, right?
Well, yeah, there is.
Or like potential to survive out of the womb, I guess.
Well, you don't have the potential to survive an amniotic fluid, do you?
I don't see why that's important though.
Well, you don't have a capability that the fetus has, and you're disregarding the fetus based off its capability. And I just brought up your own capabilities.
Right, but we don't live in amniotic fluid. We live in the world on Earth.
Well, yeah, and you're excluding the fetus of its value because it doesn't live in the world. And I just reversed it, and I said that your value is excluded because you don't live in the womb.
Well, not just because it lives in the womb, but it's different in consciousness, for example, inside the womb than it is outside of the womb, right?
Yeah, but as I said, even in my opening statement, that a like an animal has, like, lizards have some level of consciousness, and pigs have consciousness, and unless you want to embrace ethical veganism, but I think that that would be very counterintuitive to a lot of people.
But I guess what I'm trying to get at is like, why do you place value at that single-celled organism? Like, what's so special about it?
It's a human being, whether you want to say the human being is made in the image of God or that human beings are inherently different because they grow and develop differently than other animals, and that they are unique among the food chain. I mean, I think, and as I said, I think that even if you're single celled, I think you're still a human being just because you're smaller and more needy.
Okay, so yeah, I mean, we're going back in circles again because like, and it gets me back to the question of like, what makes a zygote, a single-celled zygote, a human being, right?
It's a human organism. Like, that's its identity. Like, it's an organism that performs the characteristics of life. It grows and develops, and if we give it time, water, I'm sorry, time, nutrition, and environment, it has the same physiological needs that we do. With those three things, it just comes in different forms.
Okay,
like like
so
you
so you describe it. You. So my point is, you're describing it as an organism, but physically, it is the same exact thing as the any other cell in my body. It's
Okay,
just a single-celled thing. So there's nothing really
but
special
we already distinguished, though, that it's not
about it.
identical to your skin cells, though, because you stated that a skin cell is part of an organism, but then, which is
Right,
part of
right,
you.
right.
But and then
I know it's
you say physically, but then you're making statements about how it's different in terms of like its
right,
abilities.
right.
So it's not physically identical.
No, no. Okay. So the terms, yeah, we can use the terms organism versus like a single skin cell that's part of a human, right? But physically, they're still single cells.
Single cell. I mean, at one point, yeah,
Single human cells.
they are human cells that belong to a human being, which
Right.
is you.
Right. So I shouldn't value. So I should value my skin cells the same as a zygote,
Well,
effectively.
if I would try to take your skin cells, would that would be wrong in your view?
But I feel like that's not answering the question, though.
Well, my question is that if an abortion is directly ending or terminating a life, and if there is a human being that has human skin cells or human cells, don't you think it would be wrong to take that from that person?
Well, I don't think that's relevant to my question. My question is, should I value my skin cells the same amount as the zygote because they're physically the same? And you can say that the zygote is an organism,
I
but
don't.
they're both still single cells.
Single
So
cells.
in the
So
physical aspect of things,
what's the
they're the
significance?
same.
I would. I mean, in terms of size, I guess. But okay, like, what's the point? Where are you going with that? Because as I said, we already made a bunch of distinctions. But like, for example, I can be 6 foot tall and the other guy can be 6 foot tall, and then we're
Right.
like,
So
oh
I
yeah,
guess my
they're the
point
same,
is
they're the same kind of thing. But it's like,
right.
no,
So I guess my point is like there's no good reasoning to prioritize the zygote like over the skin cell, right?
yeah,
Like
there
there's
is.
no it's just a single celled organism that turns into a clump of cells and that's all it is, right? I could say my hand is a clump of cells.
Well, we're all clumps of cells.
Yes, yes, precisely.
Yeah, but we don't kill
But
born human beings.
we like me and you, we're more than just a clump of cells. Like we have consciousness and all that stuff. But a fetus doesn't have that.
Well, that's
So
why I'm saying.
so
So what's the point of the clump of cells argument if because you pivoted to the consciousness to determine value. So
Mhm.
basically, if you're going to say that, oh, we're clumps of cells and that we're just the same, well, yeah, I mean, we're both human beings. But as I said with the animals, is that animals can have consciousness too, but we butcher animals all the time.
so I guess my point is like when it comes to the pro-life stance, it's like you're like abortion would be banned after 6 weeks or whatever, because of the value placed on the zygote. And my point is like, why? What makes it so special? And we can say it's a human organism, but in reality, it's just a clump of cells.
Well, all human organisms are clumps of cells unless you're going to appeal to a non-naturalistic
Well, and,
system.
and I said this earlier. Like, yes, we are clumps of cells, but we're more than a
More than
clump of
clumps of
cells. A
well,
fetus is just a clump of cells. It doesn't feel anything. It doesn't breathe. It's just a clump of cells.
well, it's a human being though, and that's the different thing. And as I said, is that you can get into what makes human beings valuable in general, and I gave the two criteria for that, which is made in the image of God, or that our rational thinking capabilities differentiates us in kind to different animals. Like we are separate from the animal kingdom.
Why?
Like you can make that
Okay.
argument.
Okay. Perfect. So why are we unique?
Well, I think that.
Like why are we different from other animals in the animal kingdom?
Do you want me to argue from the religious standpoint or like the secular standpoint?
I guess both. Whatever
Well,
you
I
whatever
believe
your
well
thing is.
I believe Christianity is true, so I would say that we're made in the image of God and that basically that we all have individual value and purpose in our life. And I mean that's pretty basic of well, God said so. So like but
Right.
like but then you could I would say that if I would take it from a strictly naturalistic standpoint, I would say that animal that human morality and human even debate or discourse requires severe amounts of emotional spatial linguistic intelligence, and that the big difference between humans and other animals I'd say is that humans respond to reasons why. Like humans ask why questions, like if a pig's rolling around in the mud, is that and I said, oh, like why are you doing that? The pig's just gonna like oink at me and probably eat its cousin if I put it in front of it. But like basic, like what I'm saying is humans grow and develop naturally to do those things, and I think that ability makes us unique compared to other species. And even I think that you recognize that our consciousness, at least at adulthood level, is unique in kind. Like, but someone can immediately lack the capability of our consciousness. Like, I think if someone was in a coma for 9 months, we wouldn't be able to kill them. I think if we go to sleep, we can't kill them. But I think that human beings are different for those reasons, and that we can't kill them.
Okay. So I asked, what's so important about the fetus? You said it's a human being. Okay, what's a human being? You said you gave the religious point of view, and then you gave the effectively, if you'll let me call it the humans have this higher level of experience and intellect, right? They have this human experience, right?
The human experience is what makes human beings different. So all kinds of human beings. So all human beings are part of a rational kind of being.
Mhm.
So that's what makes us different. And as I said in my opening, that kind of being would be someone like a Luke Skywalker, or like what what else did I use? Like, why am I? Oh yeah, Superman. Superman would, as I said, they grow and develop, and they possess reasoning capabilities, rational inquiry, and it's not that they immediately lack that capacity. It is that they are different from other animals. They have a higher order of existence. It's kind of more Aristotelian, but like basically it's that we cannot kill things in that view. But the simpler view is just
Absolutely.
we're made in the image of God.
Yeah, absolutely. And I agree with that. I think there is a priority to the organisms, the human organisms that have that higher level of human experience, which is why, and like going back to the kind of triage idea, I would triage the importance of a mother over a clump of cells, depending on the case, obviously, which is why I'm pro-choice.
Are you? So I have two questions. So like first of all, is that when you say just over the clump of cells, is that technically like it by definition it would be some form of dehumanization language. Like for example, like if we went back in time and I would save,
Fetus, I should say.
well, like the human fetus, the human being.
Mhm.
Like because fetus is just a term to describe the stage of development. It's like same way as toddler, like the
Mhm.
toddler, the human toddler. But
Yeah.
the thing is that even when you say clump of cells, it's technically, if we're going to take the human definition, is that it would be technically a form of bigotry, because like if you're going to say this human being
Well,
is
yeah, I
it's
shouldn't have
just a
used that term. I,
it's
I
just
just wanted to use it to
but like for example,
describe it like physically, but
if like we had, oh, a woman, and we're like, oh, I would save the woman over that animal or like whatever, and you're like, what, you mean
yeah.
Bob? And they're like, no, Bob's an animal. And you're like, what type of animal? And they're like, oh, he's a human being. And you're like, well, Bob isn't as conscious as Susie, so I mean, like, we can kill Bob. Like, I don't.
Well, I don't see that as like a. I guess I don't understand the hypothetical, but I think like in that kind of triage circumstance, that's exactly what's happening with abortion. We're triaging and we're prioritizing.
We're
So if
prioritized.
if there's something going on with Bob and that other person, and we had to
Are you familiar with
prioritize one,
active and passive dying?
I guess not. No.
So passive dying is like, for example, like parents have duties to prevent their children from passive dying. Like as I mentioned earlier, that I think I did mention earlier, like mothers have duties to provide care for their children and so on, and it's pretty rigorous. But then there's what was it? Active dying, where it's that my actions deliberately led to the cause of your death, and this is like more common in euthanasia. So like it's the difference between you me not saving you from a condition versus me administering a medication to cause you cardiac arrest, for example, which
Oh,
it's,
okay. So like choosing not to help is like passive,
yeah,
and
choosing
then
not to help.
actively adding something that harms or kills someone would be active dying.
Yeah, and then in abortion, what
Okay.
happens is you're actively causing the death of another human being. So like it would be, as I said, it would be rather than us triaging, it would be me going up to someone who is ill and then being like, "Sorry, buddy," and then like me injecting them and being like, "Oh yeah, I triage them." Like
Yeah.
I bear the responsibility of their death.
Right, but I guess that's the part where, because I feel like if I even rebut that at all, we just go full circle again. That's the part we disagree on, where like the fetus, I would say, doesn't have the same value as the human, the mother that's carrying it, right? And obviously, depending on the case, we need to measure the value of these things, the value of the suffering versus the potential of the fetus to survive, and all that stuff. Um,
I guess I'm just
okay.
curious because like if we talk about like we talked about viability, like whether like children who are more needy, like it'd be okay to end their life. You said no, and then whenever I bring up like other conscious beings, like they you haven't subscribed to ethical veganism, but like at the same time is that we both recognize that our rational capabilities is I I think that our rational capabilities make us different in kind, and I think that someone can temporarily lack their rational capabilities, but that doesn't mean that we get to kill them. Like as I said, and I think that the being that exists at conception, like, still belongs to that bigger family of
It still
value.
belongs, and it still has value, but at the end of the day, and we keep coming back to this, it's case by case, and we need to weigh the amount of suffering of the mother versus the potential of the fetus.
And my thing is that you can still take it case by case, even if it's illegal. So I don't think that's a proper objection to it. And I also think that I'm curious of what you would think. So it you brought up the suffering argument. So I would say this. So you recognize that it has some level of value, as you said, is that, but it doesn't have enough value to protect it. So I'm curious: is would you be morally okay then with, let's say that in order to reduce suffering in the form of like HIV or AIDS, a mother underwent an experiment where they experimented on the fetus but terminated the fetus before it became conscious, like to because then they could get technology to reduce like HIV or
Sorry, say it
AIDS.
again.
Ba-
Experimented on the fetus?
Basically, so 0 to 20 weeks, okay, fetus is not conscious. Mom goes to
Okay.
scientist and says, "I agree to a lab experiment." And pretty much what they will do is they will experiment on the fetus to develop life-saving vaccines and medications. So the net suffering of the world will decrease, but they get to do whatever they want to the fetuses, and they can do this with hundreds of women or whatever. It is experimentation on human beings, but you don't think that they're human beings because they're not
Okay.
conscious yet.
I see what you're saying. I see what you're saying. But I think there's a difference, where with like the reasons for abortion is almost like you're cornered and you're running out of options, whereas the hypothetical that you described is like completely elective. This woman is like, I want to, just on the chance that it makes things better, like let's just fuck this fetus up. Like I feel like that's
Yeah. My,
that's different.
my question is so like I guess is what I'm saying is would you then be in your view is that if a woman is cornered or whatever, so like do you think that all women have some level of problems? Like even if the woman, let's actually steel man it. Let's say that the woman had the problem where her boyfriend had a severe complication of HIV and AIDS, or like she was poor and that she would get money from the experiment. Would that be okay?
You get money from the experiment.
Yeah, she's absolutely broke, but the scientist says that, oh yeah, like I'll pay for your stuff if you agree to the experiment. And not only will we provide your needs, but you will save plenty of lives if we continue to help this, which is
You'll 100% save a bunch of lives.
yeah, we'll 100% save a bunch of lives. No more, not a lot of suffering for other people, but we just get to experiment on your unconscious human being. And the thing is that in your view, if it is just a clump of cells, I think you would have to admit that that should be morally accepted. It should actually be encouraged because the net suffering would go down.
Well, I guess for one thing, it depends on like where, uh, like I feel like that's a very constraining hypothetical that just wouldn't ever exist for two reasons.
Is it logically possible
Bec-
that it could?
I don't think so.
Like,
For two reasons.
okay, go ahead.
One, because you said there's no other option to get money besides do this scientific testing, and also the other thing is the scientific testing is going to be 100%, like it's 1,000% going to work.
Well, do the women that who are poor, is their only option abortion, or can they get like a job or something like that? Like, single moms exist all the time.
Right? Yeah. There are other things that can be done. You know.
So what's the weight of it?
What do you mean the weight of it?
Like, if the no other options is playing weight into the hypothetical, then why does it carry weight with the women who are cornered in life whenever we can offer different treatments or they can pursue other options?
Well, like I said, the hypothetical I think isn't like it wouldn't happen. Um,
Well, in China, actually, they did experiment on HIV and AIDS, and that's why I used the hypothetical. And a person was born with
and
like
and a woman
edited.
has no other options, and the research is going to be 100%. You see what I'm saying?
Well, I mean, you could cure AIDS. You could fix the world. Is it?
Okay. if if a group of scientists said 1,000%, hey lady, 1,000%, if you give us that fetus, you're gonna cure everyone with AIDS
You think it's
or
okay?
in with HIV or whatever. I don't think I'd be mad at whatever decision that woman made. Like that's a
Really?
huge
So,
save everyone with HIV.
well,
Like
my question is that
I'd
oh,
give up
oh
my testicle for that.
give okay, okay, but so
But I guess my point is like not just about that hypothetical being questionable, but also that's still elective. Like in real life, like I don't think that woman would only have the option to do that research, right? That
okay,
would be an elective thing versus like if the fetus starts to have extreme complications, that's unavoidable. You know what I'm
okay,
saying?
okay.
If someone got raped, that's unavoidable.
Well, I think rape is avoidable in the sense of that we punish rapists, but like what I mean is like let me rephrase
Well,
that. Let me rephrase that. Like
okay,
basically,
yeah,
sorry. I
you're good.
but I mean that we can procure actions to prevent rapists, not that like
Right. We can
it's
do
her
things
fault.
to
Like,
combat rape, and yeah, it's strict. I totally agree with that, but it's not gonna take it away completely.
does getting an
Like
abortion does an
these things
abortion
happen. Like that's my point.
does an abortion reduce like rapes like around the world? Like, for example, if like we increase the amount of
No, it's
abortions,
not.
like
It's not gonna reduce rapes, but it's gonna reduce the suffering of the mother. The mother's gonna be like imagine like the case of rape. I like I said, I think people underplay it completely. 10-year-old gets raped. Daddy, Uncle Ricky,
Uncle
me.
Ricky.
Yeah,
Yeah,
he put it in my private place or whatever. That
yeah.
really hurt or whatever. Six,
I'm.
10 weeks
Ooh,
later,
I have a question.
Daddy,
Do you,
why is my belly so big?
do
And
you
and they
think
go through all this amount of suffering, and then even after the birth, it's like what do you even do?
do you think the rapist deserves the death penalty?
Deserves the death penalty? Oh gosh, this might be out of my because I don't know the weight of like
Because this is
but actually I have an answer. I
okay.
think the rapist would deserve life in prison um, because life in prison is probably worse than the death penalty and also less expensive than the death penalty.
I would say that the expensive part, maybe in terms of suffering, yeah, but I think the expensive part isn't true. But the thing is that the interesting thing, though,
You'd be surprised because
what
there's a lot of
well, you can kill someone with a spoon, like, but I mean, the
well,
question
yeah,
is,
that's not going to be very pricey, but
well, what I'm saying though,
legal execution is very
what
pricey.
you notice though, how like the emotional aspect, like completely reasonable emotional objection. I'm not gonna be like that's an appeal to like what the fuck, but like what I'm saying is in that situation, the young girl is that we think that it would be ethical to abort the child, yet with the actual rapist, we are more hesitant to give the death penalty. Yet we are causing the death of another human being in both situations.
Yeah, but it's not the same
The rapist is guilty of a
because you
crime.
you see it as the death of a human being,
Is it a human? Well,
but
both
but
are
I
human
see it
organisms.
as we say it's the abortion of a fetus at whatever point, which would be no suffering at all to the fetus and would reduce the suffering of the mother and probably other family members too. So it
Could it?
seems like from the abortion perspective, there's a net positive of we're helping this woman and the fetus doesn't feel anything.
Well, okay. So the thing is that the rapist, there might be net positive to the rapist if you killed them, but there's more hesitancy over the person who commits a heinous crime against that than there is the innocent human being in the womb.
Right? You could say it's innocent, but it's not a human being that suffers,
Did
as I would describe it.
did
It
did
definitely doesn't suffer. It doesn't feel anything.
did it
But
commit a crime?
I would not describe it as a human being. But I mean, like you would agree, like a fetus, if you're aborting it, it doesn't suffer.
I would say
Like it
that.
doesn't feel pain.
I mean, I guess kind of. I would agree because I'll just concede that it won't feel pain, but I don't think pain is a necessary condition for moral status. Like for example, like I could hop someone up on a bunch of pain medications, I could knock them out before I kill them, but it it's
Yeah,
still wrong.
that's different because that is a person who's had an entire human a life where they grow as a person and they have their conscious human experience, whereas a fetus hasn't even began to think, you know.
Well, that's why I brought up the hypothetical in the beginning of like if it never had that consciousness in the first place, and you conceded that it like we wouldn't be allowed to kill if it was born.
Because you're exactly right, because there's no reason to, because there's no suffering from the mother once it's
Wait,
like there's no obligation of suffering to the mother.
are you saying that women don't suffer whenever they raise their children from 1 to 18 years?
There's no obligatory suffering. You could put up that child for adoption and you're done.
If you couldn't put the child up for adoption, would that justify killing the child?
If you couldn't put up the child for adoption, this is why I advocate for, like Planned Parenthood, so people have that ability.
Well, that didn't answer my question. If you let's say
Oh yeah.
that a woman who like she had her child and she was raising it and she was having difficulties at home, but she couldn't put it up for adoption. And they have baby Moses laws because women and men are both obligated through via child support and stuff like that to provide for their children. But let's say that a woman would not have the opportunity to put her child up for adoption. Do you think that she could give a medication to cause the death of her child? Like she could poison her
No,
child? Well, then
no,
then what's the point?
because that child has an experience,
Okay,
a
but then
higher level human experience with consciousness, its personality, all that.
okay, a 1-year-old child, or like even as I said, children born in the NICU, pigs can recognize themselves in mirrors.
Mhm.
So, do you think that if I kill a pig, I should be charged with murder?
No, because I understand what you're saying. Like, at some point, a pig has a higher level of intelligence than a newborn baby.
Well, yeah,
But that pig
but
doesn't have.
it's not a human being.
The pig doesn't. Right, but that pig, yeah, exactly. It's not a human being. It doesn't have the
Uh,
potential for that higher
it doesn't have a potential.
intellect.
What does the thing
Because
at the conception have a potential for?
what does what?
The human being at conception, it has a potential for what? You put you,
It has the Yeah, and I said this earlier. It has the potential to become a human being.
well, it is a human being with potential. And you said that
I wouldn't. I would not describe a zygote as a human being. No, I would say the infant is a human being
so
with potential to go to that heightened level
so
of intellect.
it's a potential human being. The Fetus at,
The zygote?
yeah.
Yes.
Okay. So potential a potential X is an actual Y. So what is it actually?
A potential. I'm not understanding. A
A,
potential
pot-
X is a
a,
what?
pot- a potential X. So like a potential um what would be a good example? A potential cake is actually eggs, batter, I mean eggs, milk and sugar. So a potential human being is an actual what?
Okay, I see what you're saying. You want me to say that it is a human being?
Well, that's because it is a human being.
No, because like cake batter is not the same thing as a cake. And if you said, "Hey, we need to destroy this cake batter," or you're gonna go into septic shock,
Well,
then
well,
then I
cake
destroy the
batter
cake batter.
cake batter is not human beings, but my question is that so this is actually oh shit, what was the comedian's name again? Bill Burr, is that his name? He used this in his comedy skit.
Bill Maher's another one.
He's bald, shorter. Um,
Redhead.
I think so, but
That's
uh,
Bill Burr.
Bill Burr, yeah, he used this about the cake and that basically the oven is the woman's womb. But my question is that we don't stop baking even after we're born. People grow and develop their entire lives. Like I think human males don't reach their peak strength or even cardiovascular fitness until they're 25 or even 30s, and our brains don't develop fully until we're 21. So if we're going to say that a fetus is not a human being because it has to bake, then younger dude, I'm fucked. Like, but like I mean I'm 22, but like so I wouldn't be considered a full person if you follow that logic.
You are not your full capacity. That is true. You
That
still have more neural development, but you've also see. I see what you're saying, but there's thresholds or distinguishing factors that we need to consider. You have your own personal human experience, which is already heightened above other animals, and two, you don't cause obligatory suffering to anyone else.
I think my family would disagree with but like
But do you understand my position better?
I see what you're saying, but my rebuttal to that would be that I think that I think first of all, I would disagree that all suffering is inherently bad. I'm not saying that, oh yeah, kids with cancer, bro, suck it. No, I'm not saying that. I'm saying that, like, for example, any form of committed, loving relationship, you're going to make sacrifices, and I would consider that a form of suffering. You go to the gym, that's suffering, but like you get out of it still. So I would disagree with that, but also I think that just because someone causes another person to stress, I don't think that justifies killing the other human being.
Well, I wouldn't say a couple things. One, I wouldn't just say stress. Like those things are the reasons for abortion are not just stress. Um, and then also the suffering thing, I disagree with like there's some suffering that we should be okay with. I think it's more about the net suffering. Or you get
Hello?
that. Hear me?
Yeah,
Did
I
I
can
cut
hear
out?
you. You're cutting it.
Uh-oh.
I think I got your point of net suffering.
Yeah, net suffering. Sorry, my laptop's like at the edge of the Wi-Fi, so
Oh,
sometimes it might do that. But the net suffering is like, yeah, your example of going to the gym, like, yeah, it sucks, it hurts your muscles, you get sore, but you also get big. There's a net benefit. If there wasn't a net benefit, I wouldn't do it. Um,
but
so
not
so
but
same thing with abortion. If there wasn't a net benefit, it doesn't make sense to do it. But in with like working out, I would prefer there not to be the soreness of muscles. Just like with abortion, I would prefer there not to be any suffering. But that's not
mm,
realistic. We need to balance out the suffering.
what so this is just a utilitarian like worldview, and I would say that even if I brought up about, I mean, you did kind of concede to the genetic modification hypothetical, but the thing is
I
that if
don't
you're going
remember what that was or what I allegedly conceded to, but
uh,
sure.
the the basically if the woman would cure 1,000 people with HIV or AIDS if she could get an experiment on her 0 to 20 week fetus.
I mean, yeah, in that very um, outer space hypothetical, I guess I conceded the point that if a mother could give up their fetus to save every single person with HIV, I'd say I'd be okay with whatever decision she made. I
So
guess I conceded that. Yeah.
this is I think this is the problem with utilitarianism because I can just basically make any hypothetical then. Like, so let's say you have a 1 to 2 year old, they have the conscious experience, but if you stab the baby, 50 people will be cured of cancer. Do you think that would be okay?
Okay. I see what you're saying. If you stab the bill, 50 people would be cured of cancer.
Yeah, it is the because like if you're going to make the argument that we ought to pursue net positives, is that you would have to either because in philosophy there's utilitarianism, virtue ethics, and deontology, and usually people would say that there's something inherently wrong with stabbing a baby to cure 50 people with cancer. But if you take the absolutist position of the ends justify the means, then stabbing the baby would be morally justified.
I see what you're saying. And I think I need to clarify my position on suffering. One, like if you kill a baby, for saving 50 other people, the baby's still suffering. But with abortion, the fetus doesn't suffer, right?
The,
Um,
the, the baby gets anesthesia beforehand.
okay.
you,
Um, well, then that brings up ethical concerns of killing that baby, which has that human experience. But also, I think I need to clarify my position on suffering because I think there is a net effect. What I described earlier, and I don't think I represented myself well with that.
yeah.
But also, you do need to consider that even though there is a net effect, there's still individual suffering. Like that doesn't take away the suffering of the muscles, burning, right?
So basically, that there is a positive effect, but there's also a negative effect, is what you're kind of getting at. Like,
Yes.
if I could have the positive effects without the negative effects, do you think?
I mean that would be optimal, but like we need to effectively what I'm trying to say is like there's always going to be suffering with like a positive and a negative, right? There's going to be some level of suffering. So we need to weigh that level of suffering. So with abortion, the suffering of a fetus is pretty much zero. There's like virtually no net negative because there's no feeling,
Mhm. But the
right?
situations
And, and
where
and we're weighing that against whatever the case is, right? Like I don't think after 20 weeks it'd be okay to abort someone just because they want to or whatever,
Mhm.
or for some superficial reason. So we're weighing these things.
Yeah, and my question is do you think that people have different thresholds of suffering?
Absolutely.
So
I
if
think
I
people consider
if
differently, which is
so
why I think pro-choice is so great because it gives people those options.
but my question is so your position then would be not only ad hoc, which is arbitrary, but fundamentally it wouldn't really carry much weight because like for example, would you say that let's say a woman is 30 weeks pregnant and she's pregnant with twins and she's like, I really don't want stretch marks and I'm going to be embarrassed in front of my husband. I'm going to be saggy and I'm going to suffer. I might lose my marriage. I want to pursue an abortion. Or no, it would be fetal reduction surgery where they literally take a wire and they like stab it through the child's head. Like, do you, do you think that that would be acceptable?
No, that's completely unreasonable. Just
Well,
because you have stretch marks?
well, yeah.
No, that's completely unreasonable.
Well, okay, but you earlier said about suffering, but if you're saying that other people define their threshold of suffering, then who are you to say that her threshold of suffering isn't reasonable?
I see. So I think I need to describe my position better then, because yes, we're weighing the suffering, but I am, you know, uh, I mentioned this earlier. It's not
Mhm.
just the suffering, it's the suffering and the potential of the fetus, which is why
The human
that
fetus.
yes, it is a human fetus, which is why it needs to be regulated. And there needs to be rules to these things, like the 20 week, medical necessity threshold,
Okay.
right?
Did you want to
So,
wrap
so
up
there's
with
levels. There's
Did you want to wrap
Yeah,
up with
sorry.
closing?
No, you're good.
Did you want to wrap up with closing statements then, or?
Yeah, actually, I do have some things some hypotheticals I want to ask you, just because
Okay.
you gave me a billion
Uh, uh, uh,
hypotheticals, which
okay.
which I appreciate.
Yeah. Yeah, you're fine. Hopefully, I'm
Sorry,
not.
you need to be somewhere?
No, no. I just was wondering because we've been chatting it up for like
No.
2 to 3 hours, and I was like, you know, I'll answer your hypotheticals. I was just wondering, like, you know, if you had a time frame or something like that. But yeah.
No, I don't. I appreciate it, though, and I understand. This definitely got a little muddled. There wasn't really any rhyme or reason to these conversations.
Oh no. Yeah.
Um,
Go ahead with your hypotheticals. I'll answer your hypotheticals.
I guess my first one actually isn't a hypothetical. So with religious position, your religious, okay, it's and maybe not just you, but other people who just solely base their position off religion. Why should that dictate other people, especially given that other religions don't
Agree.
think there's life at conception, right?
Um, in the Abrahamic religions, no, but I'll just grant that like maybe there's some polytheistic religion that doesn't grant that. I would say
Well,
that
like Islam, it's at 120 days. Judaism, it's at birth.
I would disagree with that, but here I'll just grant it though. Um, Even in those situations, I would say that every person of regardless of their faith has a worldview, and every worldview has moral or ethical claims. For example, I think that even an atheist or secular person would argue that women have a right to choose, which is an ought statement, which would basically, if someone would violate that, there would be consequences to that view. So I think that I respect people's freedom of conscience. Like, I don't think that I can forcefully convert people, but I think everyone has views that they're technically willing to enforce on others. It's just we
But should we?
should we? I think that that's what laws literally do. Like a law
Right,
forces your belief on others.
absolutely, yeah, yeah. But should we create those laws based on religion and enforce other people to obey those laws because of how one group feels religiously?
Um, I mean, I think you can the same way that everyone does it. Like as I said, every worldview has moral claims that they force on others.
Right, but should we?
Should like I think that we can. I
Like,
mean,
should someone else with their religious views be like, I'm going to make a law based on my religious views, and you have to follow it?
they can try. I mean, I can argue against it, but like, like,
Right, like you absolutely would.
well, yeah. I mean, I think that's why I respect free speech in general. Like like,
Okay, yeah, but we're not talking about free speech.
but what I'm saying is that sh- should other people be able to? So, to rephrase your question, are you saying that other people should be able to argue for laws that force certain doctrine on me?
Well, that's kind of what pro-life does, right?
Well, that's what Democrats, Republicans have been doing for the past 300 years of existence. So yeah.
Well, I mean, like, there's definitely motivation from religious texts, but there's a reasonable amount of freedom when it comes to a lot of laws. Um, and I think there also should be a reasonable amount of freedom with the case of abortion. Like, specifically, what I mean is like pro-choice. It doesn't limit people from not having abortions. If you don't want to have an abortion, you don't have to have an abortion, and you're not harming anyone else's religious beliefs, right?
Well, you're harming the fetus, the human fetus in the womb, though.
That's a religious belief.
Well, I mean, it was technically a religious belief to say that um, black people are human beings like you and me.
Yeah, but that's also just like a moral, like, it's not purely religious.
Well, religious views usually concern morality in some extent because, I mean, everyone has a I think everyone has a worldview. So like to just disregard something on the basis of religion would you would have to necessarily disregard things on the basis of moral worldviews in general.
Okay, I guess like what I'm trying to say specifically with pro-life laws, like that specifically is like a Christian thing, right?
I would say that it has to do with Christianity. Yeah.
Yeah, absolutely. So I don't think it's just to force other people to follow that route. Don't you think that's the case, especially since America was built off of religious freedom?
Um, I think that it can be justified to protect other human life. Um, and I think that even you're okay with forcing me to obey pro-choice laws.
Well, if I force you to obey pro-choice laws, you still have full capabilities under those laws to go through pregnancies and abortion however you'd like.
So
I'm not restricting you in that way, but
I
pro-life does restrict other people's views.
I have a question. So if someone goes up to an abortion clinic and they put a sign or like they stop women from going into that, do you think that they should be punished for that?
Well, I think that's illegal. Like you can't block
So
people's.
so you're using a law to enforce your belief of autonomy on other people.
Well, no, the law in that case it goes for like any private area where you
But that is your
can't just
autonomy
like
though.
block. I think I'm confused on the point you're making.
I'm saying that you still like even if someone would try to stop a doctor from performing an abortion, you think that that would fall under violating that doctor's autonomy, which you would still and that person would procure consequences for that, which you would be forcing your belief on that person.
Yeah, I don't think you should force your belief on other people.
Well, you're forcing your belief on the other person because your principle is
I would be.
autonomy. Yeah, because your principle is autonomy, and if someone
Mm-mm. That's
violates,
not what pro-choice is.
well, when I
Pro-choice is not you have to have autonomy. Pro-choice is you can make decision, you can feel however you want to feel and make decision based on whatever you want. If
that's
under
what
pro-choice
autonomy
someone
is.
feels like autonomy, oh okay, I guess then yeah. They're then they that the mother should make their own decision, that's fine. But if you feel like you want to do a pro-life um position, you can do that under pro-choice. There's no limits.
But if someone goes against that moral, like your prescription, like people should or people can do this or that, if someone goes against that, you're going to
Yeah, but
enforce that.
if someone is pro-choice having an abortion, that's not affecting pro-lifers.
It's affecting the human in the womb, though.
That's in your view.
Well, if someone goes up to someone and stabs someone on the street, I mean, that's not affecting me, but that, I mean,
True?
love thy neighbor. Like, I don't think that you should be able to stab people.
Right. So you're I mean, yeah, but that's different circular difference between human outside and baby inside or fetus inside. But
Change in location.
okay. Um but anyways, because I think we just went wrapped around in a circle there. What was my other Oh yeah, just to test some
It's reaching that
All right,
moment.
if you had to kill 10, if you had the option to kill 10 single-celled zygotes or 5 9-year-olds, who would you kill?
Oh, geez. I don't really. I think this is. I guess this is to see if I view them as equal. 10. Okay.
10 zygotes, 5 9-year-olds.
5 9-year-olds. Do I get the option to not kill either, or do I have to choose?
See, that would be the preference, but in this hypothetical, you have to get
Uh,
rid of one group.
so if I answer the 9-year-olds, am I instantly damned to hell, or like?
I personally would not understand the purpose of choosing to kill 5 human uh,
I
organisms
I mean
who are experiencing their world as we know it
I
versus
I
two
just.
single 10 single-celled organisms.
But the thing is that so here's also a problem.
So
I'm not.
you would choose to kill.
I'm not. So this is the problem: is that even when I go to make this choice, is that I'm not a utilitarian. So like if you're going to ask me who I would kill, I mean, it ultimately depends. Like, if it's like a trolley problem where like I pull the lever or not, that'd be different to me than like if I'm literally going up and slitting these kids' throats. Like, I would probably, if I'm doing that, then
Probably
that
problem. It's inevitable. We'll do it like that.
trolley problem basically, I don't do anything. It runs over. Um,
Okay, actually no, because that adds a different aspect to it. No,
that
you just you have a button.
that's what I'm saying though is that like my
Yeah,
view.
you have a button. You kill one group or the other. That's it.
Um,
You have to. There's a gun to your head. If you don't press one button, you die.
okay. I mean, like that's not much of a choice. That I'm just like, blah. But
Well, like I think it's easy for me. Like I would pick. I would kill the 10 single-celled zygotes.
so I press the button and it kills the 9-year-olds.
That's your choice.
Well, no, if I
If
this
you press
is
the button, it kills. If you press the button on the right, it kills the 9-year-olds. If you press the button on the left, it kills the 10 single-cell zygotes.
and I have to choose or my brains get blown out.
Yeah, that's right.
I mean, the gun would go off. but but I don't know, I guess. If I don't know what choice I would make. If I went with my emotional side of things, I feel like I'd be like, "Oh gosh, those are little kids looking at me." But
Exactly.
if I went over on a utilitarian basis or like the number of people, I would have to go with the like it depends. Like if it's the number of people, then
You're
uh,
feeling emotional about the 9-year-olds because they're living, breathing human beings with an experience.
well, I already said that like my choice would be to not kill any of them. I could see that
Right,
like I
right.
imagine them as equal
But
though.
do you see why I'm posing this question?
Well, like the thing is that the reason I give my answer though is that like technically I imagine them as equal in the sense of oh here are 10 human beings, here are wait what was however many zygotes, and that
10
here
single-cell zygotes and 5 9-year-olds.
5 9-year-olds is that I think that there's different weights to it. Like there's more human beings here, and I recognize that depending on the means of doing that. Like for example, if you had another hypothetical where it was a um a
But
per
we have this hypothetical. We
we
have this
have
one. This is the hypothetical.
uh,
And okay, just real quick, the fact that you're not like answering makes me go back to part of my opening statement where it almost feels like moral grandstanding. Where it's like, okay, did this person just pick this position because it's so simple to say like, oh, I just don't want to murder a human or whatever.
well that's like
That's what it makes me think. It's
I
like,
I
are you just not
no I
being honest?
no I think that it's like asking me if like I would rather kill my brother or my sister. Like, no, you don't. You imagine people as equal. Well, like, would you choose to do that? I'm like,
But if you had the position that you have and you value zygotes equally to human lives, you would say you'd kill the 5 9-year-olds
but
pretty quickly, right?
I
So it
feel
makes
like
me
I feel like that's a
it
big
makes
jump in
me
logic.
I don't think so. It just makes me question your position.
Do I think that the?
It seems inconsistent.
I don't think it seems inconsistent. I think that, as I said, I think that both are human beings and that I wouldn't kill either of them. And if you're gonna force my hand,
Of
then
course, of
like,
course.
if you're gonna force my hand,
I already answered the question.
then okay, the 9-year-olds, I guess. I mean, I'm being forced to.
I it's just it's for consistency's sake, and I personally, like I said, I would kill the single-celled zygotes. I don't understand why anyone would want to kill 5 9-year-olds over 10 cells that don't have consciousness and are just single cells.
Well,
Um,
as I said, I would probably let the gun go off. I would rather myself die.
that's fair.
Like,
Okay,
but like basically the problem is that I feel like this is a non sequitur hypothetical because, as I said, I would say that there is all human beings have value, and I already said that not only am I not a consequentialist, but the way or means that you do to save them, the way the means that they die, carries some moral weight. So like there would have to be more variables to this hypothetical for it even to be valid to criticize my
nope,
view.
just those two. Just kill one group or the other. But I understand where you come from.
Yeah.
If a single-celled zygote is a human being why can it not be insured?
Um,
Does it get benefits?
People are outdated.
And also, why,
If
if life begins at conception, wouldn't a single-celled zygote be considered a citizen if an immigrant had sex in America and the egg got fertilized?
I don't believe in birthright citizenship.
Okay, but under the law currently,
Um,
if a child is born in America, they're a citizen. Shouldn't that be the same case for a single-celled zygote?
yes.
Okay. So it seems kind of strange that that doesn't actually happen. Makes me think that maybe not yours, because you're consistent on that part, but other people and the people putting this into law are morally grandstanding.
Actually, I if you look into the legal law of whenever I think it was the I'm not sure if it was the 14th Amendment, most states did prohibit abortion. It was just when life actually began that they didn't know. Like basically, so like whenever you
I
got
guess I'm
into even
confused why
like,
that's relevant, but
oh sorry, my bad, but like basically, even when you get into the 14th Amendment, the main clause that is under dispute is jurisdiction thereof, and that has to do with the legal status of the parents in general. But if you're going to say like if two like if we're going to follow the law now and you're saying that two parents get together and a child is conceived on American soil and that we're going with the birthright citizenship laws now, I don't see why that they wouldn't be a US citizen.
at conception,
Yeah.
no, I think that's fair, and like I said, that's your position. But it makes me question, the lawmakers and the other people who say that they're pro-life when they don't commit to that. Like, why aren't they committing to that? It seems like pretty fake. It seems like they're just trying to garner eh, popularity from their position. But anyways, um, women with IUDs.
Okay, Dean
Do
Withers.
you do you know who? I mean, it's a valid argument.
Yeah,
Um,
I've actually debated that
you're
with
fam-
Dean Withers. Um,
Okay, so you're familiar with
yes.
the fact that IUDs prevent the zygote from
Hmm.
implanting, so it effectively kills after conception.
Yeah, basically, they actually do have laws for that already. Basically, medical
Fair.
professionals, if they um, look up intrauterine fetal demise, basically, and you can find at the bottom of the page, you can pursue legal treatments and legal remedies if, because a medical professional has a duty to provide care to the child. But the thing is that unless um, you know that you are pregnant, the provider would be charged with negligence. So I would just extend that to conception. That pretty much is that pretty much if a woman
Yeah, but
knew that she was pregnant and then her actions continue to endanger the life, she would violate her duty to provide care for her child and be charged with negligence.
but it doesn't even get that far. It's undetectable. You
Well,
wouldn't be able to detect if
yeah,
the egg was fertilized or not.
and that's why I would say that wouldn't be murder because murder requires intent and forethought.
But it is the killing of a as you would call it, a human being. Would you not?
Um, I guess it would be. I mean, it's more like a if a human being ran into my car when I was like keeping it still, and then saying I killed them. Like
But that's not what's happening. People are intentionally putting in IUDs, knowing that this is what happens,
that's not the
right? And I'm
intent of
sure
the
there are
IUD though.
plenty of pro-lifers that have IUDs in or have girlfriends that have IUDs. So it seems inconsistent with the pro-life side that
I
they
would.
would be okay with IUDs or they would not advocate against IUDs because
Well,
people are knowingly using these.
I think that basically, as I said, is that you can get. I know Catholics, for example, they disagree with birth control, but they won't consider an IUD murder for the fact of, as I said, it's unintentional. And then if you're going to say like it's manslaughter, I think that, as I said, is that you would have to go into the knowledge and forethought of the duties of the parent and what is reasonable at the time, which we already
Yeah,
have
but
laws
but
for
you
and precedent.
know
We have
Yeah, but
precedent
you
for it.
know the effect of an IUD. Like if you know, like, oh, this IUD is going to kill the egg after
We don't
conception,
know
you
that.
have
We
that,
don't know that though. Most of the time, it doesn't
but you
happen.
do. That's what happens though.
It can happen, but as I said, is that you can't charge someone for intentionally doing something when they could mitigate it. It's just that there is no reasonable way to mitigate it.
But there is by not getting one.
By not getting
So
one,
would it not make sense that pro-lifers just wouldn't use IUDs or wouldn't have a girlfriend with an IUD?
well, a lot of pro-lifers don't believe in IUDs because a lot of, for example, Catholics thinks it's a crime against nature to use IUDs. Like
Right.
they don't believe in birth control.
So why don't we see any bans of IUDs?
Well,
Why does it stop at
birth con-
abortion?
birth control used to be banned though.
Right, but it's not now. In even in strict anti-abortion states like Texas.
Well, as I said, I don't believe in banning birth
So
control
why
because
it just seems so weird that it stops at abortion. What if the pro-life stance is that okay, the life is important at conception? Why are IUDs not banned?
for the reasons I gave you, that it doesn't directly kill an innocent human being, which was my premise of my argument.
Okay, well then I guess we can agree to disagree on that. If okay, next question. Two, they're twins in the womb. One of them eats the other in the womb.
Hmm.
If we're pro-life position, we should jail that fetus then.
No, because it, as I said, the child does not have intent. In order to charge someone with murder or homicide or negligence, is that would be in the category of spontaneous or natural disaster.
Okay, so you agree then that the fetus does not have the conscious capacity to make decisions in the womb.
Yep, same thing like a 1 or 2 year old.
Okay, I mean 1 and 2 year olds can make decisions, but
Do they choose what diapers they want?
that's one decision that they don't make, but they still make decisions and they think.
Think. Well, do you remember anything you thought of when you were 1 years old?
No, that was a long time ago. I remember when I was two.
You remember reading? Okay. Well, I guess
I mean,
you did.
yeah, I don't remember those
I
things, but
guess
that
you.
doesn't mean I wasn't thinking.
Well, I guess you didn't have your conscious experience. So, if the net suffering was,
Well, I'd say no to that. Just because I don't memorize those moments doesn't mean I wasn't consciously thinking about things, right?
so it is possible though that a fetus, even before your 20 weeks, might not remember, but they are experiencing it.
No, because the fetus is not conscious.
Well, I
Because
guess.
I guess let me specify because there's a difference between conscious decision making and the ability to create long lasting memories.
Well, consciousness is multifaceted, and it exists very much so on a spectrum.
Yep.
And so you're saying at X amount it is conscious, but then beforehand, whenever it still has some level of reacting to its environment, it's excluded.
I think you need to get more specific.
Well, like what I'm
I don't
saying
know
is
what.
that like if you talk about consciousness in general, the 1 year old lacks plenty of capabilities that conscious adults do not have, but uh, whenever I hone in on that, you're like, well, just because someone doesn't remember it doesn't mean that they have these other capabilities. But then, like, the further we go back, it's just like a certain point where it's not conscious, like, just altogether.
I see it as a pretty clear distinguishing. If it's in the womb, it's not conscious. If it's out of the womb, it's conscious.
So, an 8-month-old child is unconscious.
No, it is conscious.
Well, all children in the womb are sedated.
Okay, when you say 8 month child, do you mean 8 month fetus
Well, all fetuses can be
in the womb?
children.
Well, okay, yeah. My point is, yeah, if it's still in the womb, it doesn't have that consciousness. But when it's born, it literally creates. It literally wakes up. It feels the air and it wakes up.
Depending if it's healthy or not.
Okay, yes, but you understand my point.
Yeah,
Sometimes it takes a little bit of time. But
but I mean, I don't think that if someone wakes up or not means we can kill them.
No.
Well, then what before the 20 weeks? Like, what's your standard? Because like, what trait? Like as I said, is that if we're going to be going by degrees of consciousness, why don't we just exclude the 1 or 2 year olds to be more consistent with like the pig I mentioned earlier?
No. Because they have consciousness, and yes, at
But
that moment
but it's not as
they
much as the
are
pig.
effectively the level or below the level of the pig, but they have the capacity for greater potential, right?
Well, the fetus before that has capacity for greater potential. It's just that that degree of consciousness you do not value.
No, it doesn't have consciousness.
Well, all
In the
things
womb, it
have
doesn't have. It's not
all
conscious.
things have some level of consciousness. Like especially
It,
organic things. Like I would disagree with that because like for example like if we're
you
going
could argue that it has like electrical activity, like the nerves have grown and there's signals being sent, but the child is, or the fetus is not awake feeling things in the womb, right?
well that when you get into the word feeling versus reacting like
Mhm.
I
That's
that
different.
well it just is completely arbitrary then because like for example a like it just magically at 20 weeks it starts to feel things. But then we brought up the encephalic case,
No,
and
no, that's not what I mean.
well, like what's the difference between
It's
feeling
not
and
that
reacting?
at 20 weeks it magically feels things. I think there's more value in the fact that the fetus can survive outside of the womb at that point.
Well, you're diverting to viability. We're talking about consciousness.
But you said that there's a change in consciousness at 20 weeks. I disagree.
There's no change of consciousness at 20 weeks.
Well, like there's growth in the nervous system, but
If there's no
it's
change in
unconscious.
well, if there's no change in consciousness, like your whole position would then implode on itself because if it doesn't go from unconscious to conscious, then there is no pro-choice position for the consciousness argument.
No, because when you take it outside of the womb, it gains consciousness.
Well, it not necessarily though.
Yes, but you understand, like at 20 weeks, it has the potential to have consciousness outside of the womb.
Well,
It's like a 1% chance at like 20 weeks or whatever, but
at conception has the potential to do that too.
you can't take a zygote out of the womb and it'll survive. That doesn't happen. It'll just
Well,
die.
children, like as I said, like that's viability. Like you can take a child outside of the womb at 20, 30 weeks and it might not be viable.
True.
So what's the point?
Because there's a percent chance that it's viable.
Well, Curtis, the world
Before,
record was
like,
99.9%
non-specifically.
chance of dying. So Curtis, his life just like he's the world record holder. He was born at 21 weeks, which consciousness, as I said in my opening, that the world record is 28 weeks.
For what?
Well,
Oh,
sorry, 26 weeks. So Curtis was born at 21 weeks when most, like some later estimates say consciousness develops at 26 weeks, according to New York University. So Curtis would not be conscious under your view.
Curtis is who?
The world record holder for the youngest born child.
Which was when?
Um, like the year he was born,
Or no, the weeks.
21 weeks.
You said 21 weeks,
Yeah,
and that's when he was born.
21 weeks, and some estimates say consciousness does not develop until 26 weeks. New York University.
Yeah, well, okay, yeah. Some estimates say that it's like not like fully conscious or whatever, but I think you get my point. Whereas
Well,
like inside,
I want to know: is it okay to kill Curtis or not?
no,
Well,
because and this is circular again because Curtis, once outside the womb, has no obligatory suffering to the mother.
but all children are going to obligatorily cause suffering in some way. Even if you said that there wasn't, like they were forced to take care of their child, like it wouldn't shift the weight.
I don't understand what you're asking. Sorry.
What I'm saying is that if the mother couldn't put it up for adoption, you already said that that would not be significant for the woman to kill the child.
Right.
So the obligatory suffering doesn't matter, and that whenever we talk about consciousness, is that, as I said, there's the ethical veganism, which, if you're going to value consciousness, but also the fact is that the line in the sand is completely arbitrary. Because, as I said, if I give medical estimates that say it's at 26 weeks, you say, oh, it's conscious whenever it's out of the womb. But then I bring up how people might have a medical condition that might make them not conscious, and then
I
you say
guess
that,
I guess
well,
then
that's different.
I guess by saying that I'm valuing consciousness is is not what I should be saying. I should be saying survivability.
Well, not all survivability. I mean, isn't that a little
Well, I
eugenicsy?
guess it's both survivability, and I said this before. Again, like I need to make sure that I'm putting the two together: survivability and consciousness, right?
Survivability and consciousness. So like, I don't see how that follows because, as I said, Curtis had a 99.9% chance of failing.
Is a percent to survive. It's still there.
No, there's a percent to survive. Well,
Mhm.
you you could consider that 0.1%. I mean, I
Yeah.
I mean, I guess if you're going to go off of 0.1%, then there's a 0.0001% that a miracle happens and the 8-week fetus God comes down and blesses the baby right there. Like,
I, I completely understand what you're saying, but I think that's an impossible distinction to make. I think the threshold is like, okay, the doctor is going to say there's no chance it survives outside the womb, and the doctor says there is a chance it survives out of the womb.
so
That's the threshold,
I'm
because
wondering,
that's the best thing we got.
does the doctor actually run like a big equation to like determine, like, do they like go to like a chat GBT thing? They're like, here are the factors and like the chances and probability of life or death, and that's what determines if we can
Well,
cause the death of another human.
I don't think that's a good representation because doctors go through, a decade of training for this. So they have many ways of determining that, and it has to be taken case by case. But they're the highest
Trust the
level
experts.
of professional opinion that we can get. So that's what we have to go by.
So doctors have the right to determine to cause the death of other people.
Nope, they give information, and the mother makes the decision.
Well, so with the consent of the mom. On top of that,
What with the consent of the mom?
a doctor has the right to cause the death of another human being with consent of the mother if the doctor so thinks there's a probability that it might not survive.
If okay, so you're saying in the case that the fetus isn't going to survive?
Well, the case of it surviving or not is entirely dependent on the doctor, like what he says, in your view.
Right. So the doctor is either going to say there's a chance that it survives or there's a chance that it doesn't survive.
Yeah.
And then based on the circumstance of the mother, that's when you would make the decision.
So what I'm saying is, if the doctor just said that, like, would there be would there be any grounds for disagreement?
I mean,
Is the
would there
probability
be
external to the
like
doctor, or is
like
the
the mom
probability?
is going to be like, no, you're wrong.
Well, like what I'm saying is, like, you're saying that the what determines if we kill this child is pretty much the doctor's probability of saying it survives or not. And
Mhm.
we already ran that the doctors does not run a test. But the thing is that it seems that the probability is not actually intrinsic to any of the factors. It is literally just entirely based off of what the doctor says.
Oh, okay. So the doctor's gonna tell you, and you don't know if it's right or wrong. Well, that's why you get multiple opinions.
Okay. So like you can get multiple opinions, but that doesn't mean it's right or wrong.
Right. So you get multiple opinions, and the doctor say, okay, here are your options, and you pick. That goes.
Well, I don't see how that adds any weight to it then, because like a doctor could be like, oh yeah, we could save this. There's a 0.01% chance, and then basically the other doctor is like, oh yeah, by the way, like it's not going to live. But ultimately, the doctor's opinion does not actually make the decision. So like, why is that significant in whether it should be legal or illegal?
Well, then, like, what alternative do we have?
Well, what I'm saying is that the alternative is that we get rid of abortion. Then
So,
doctors will not have
but
to.
but but then the mother just suffers. So that's my
Well, mothers can suffer. People suffer all the time, but it doesn't justify killing other humans.
Right, but then it comes back to we're measuring
That you
the
don't,
suffering of the mother versus the
but you don't imagine the fetus as a person.
right because it's not.
Well, it's a human being, and you mentioned about the cells, but like it's a human organism. It grows and develops. It has the potential to grow and develop like you and me. It requires time, nutrition, environment. I mean, I need food, water. I'm living in my dungeon right now, and this is my womb, I guess is what I'm saying. I'm a redditor.
Yeah.
I live here. No, but like
No, you're good.
basically.
Well, I think it's time for closing arguments because we're coming around in the circle again and
uh,
again and again.
Okay, that sounds
But
good.
effectively, my answer to that would be like that's why we have these thresholds and we take it case by case and we get multiple opinions. And why pro-choice, in my opinion, would be better because there's more assistance and you're going to have more support available. When you have to skirt around the laws, it takes time and like you might not get the best care. Whereas under pro-choice and these restrictive laws, you can get multiple opinions at a clinic. You can go to a clinic and get multiple opinions and all that stuff. And I'm just going to continue on just as like a closing statement or whatever.
Okay.
Additionally speaking, what Connor mentioned was he values what he would call a human, and because it's an organism, and to me, I see those as just words categorizing what we know as in the case of a single cell zygote, no different than any other cell in the body. So when we prioritize these things, as if we're in a triage, we need to consider the level of suffering, the mother suffering versus the fetus's suffering, which is zero. But we also need to consider the survivability of the fetus, which a big threshold is at 20 weeks, about 20 weeks, where the fetus can now survive outside of the womb. So that should bring more strict regulations. After 20 weeks, it should require a medical necessity. So only allowing an abortion if the mother is suffering to an extreme extent for whatever reason. Additionally, we wouldn't need to get to these points because under pro-choice law, there's better reproductive care. We have clinics that help people talk through the stuff, that feel more comfortable in these situations, and there's better sex education. So once again, all of that stuff is going to reduce the amount of abortion, and also getting back to the religious debate, people who use religion as their arbiter for their decision, whether pro-life or pro-choice, clearly for a lot of religious people, there's inconsistencies, especially when it comes to IUDs, for example, but also the fact that it's forced onto other people, I don't see as a reasonable option because this country was built off freedom of religion. So we should have pro-choice law where people have the freedom to have an abortion or not. And once again, obviously, those abortions aren't completely elective all the time. There should be regulations to these things. As I mentioned before, and that is I guess that's the gist of my argument. I know this was a very muddy debate, but I
Extended.
hope through these hours it kind of became clear, especially with all these hypotheticals that you gave me, that there are different decisions to be made depending on the case that is presented, which is why these things need to be taken case by case and they need to be evaluated by a doctor, multiple doctor, all those things, to make sure that people are getting the right care and they're making the right decisions and they're not abusing their autonomy.
Okay. So is that your closing statement then?
Yeah, I guess.
Okay, sweet. So my closing statement is going to be pretty basic. Is that I think that my argument stands that it is wrong to intentionally kill an innocent human being, and that a human being or a member of the species Homo sapiens or exists at conception and it grows and develops, it has potential, and that these are not potential humans, these are humans, as I said, with potential, is that you and me are valuable and we have value within for what we are, not what we can do. I think that we do not get to kill other human beings for the sake of that they cause other people problems or suffering. I believe that women have plenty of needs and problems in society, and that I am completely open to helping women, especially as I said, women who are victims of things like SA or rape. I think that they deserve the world to them, and that we should help them by any means. However, I don't think that those means extend to killing the innocent, and if there was any violence involved, I think that should be directed towards the evildoer who wronged her. And if we're going to get into a country of freedom, is that freedom or autonomy does not extend to hurting or harming others intentionally, particularly ending another human being's life, is that there's serious restrictions in the United States whenever that happens, and that every single worldview is going to enforce some level of belief, whether that is, as I said, harm, autonomy, or anything like that. And I think that okay, so basically, I think pretty much even we can take it a case by case scenario. Even if we make restrictions, and that women can receive medical care to value their lives, and we can stand up for not only the unborn but the unborn, sorry, we can stand up for the unborn, we can stand up for women, and we can stand up for the lives of unborn women, which unfortunately 500,000 unborn human beings die every single year by the hands of people who use medications or abortive procedures, and that I think the consciousness argument ultimately defaults into arbitrariness in general.